Good morning, everyone. Just going to remind folks to mute their computers if you haven't already. Happy Monday. It's nice to see everyone here. Thanks for your patience as we get started a few minutes late this morning. Welcome to our JF committee meeting in public health. And before we get started today, I'm just going to begin by sharing some exciting and happy news. One of our vice chairs, Representative John Michael Parker, in the midst of all of our conversations about maternal health and all those things, is now a father, a new father. So congratulations to Representative Parker and to his wife Joyce on the birth of Charles Michael Parker. And we know they're all doing well, and we know our best wishes are with all of them. So we have a wonderfully full agenda this morning. So with that, I'm going to turn it over to Senator Anwar for any opening remarks.
Thank you so much, Madam Co-Chair. I'm sorry I'm not physically there with you. Today I'm covering the intensive care unit, and I may get called in and out of rooms. So if I don't show up for a little bit, especially for difficult votes, that's because I've been called for patient care, and I have a procedure at 1:30, so I will be unavailable for a little bit of time. So I wanted to give you a heads up, and looking forward to good votes, some very important bills today, and looking forward to everybody's contribution. Thank you, Madam Co-Chair.
Thank you, Senator Anwar. It's truly all around public health. And Senator, just so you know, I think some of us may have had a little bit of a difficulty hearing you. So when you're speaking, just maybe use your outside voice if you would. Senator Summers.
Yes, good morning, everyone, and welcome to a very busy Public Health Committee meeting today. I'm looking forward to having some discussion on one of our 18 bills here, and I'm hoping that the leadership has worked really hard to try to get many of these bills to be consensus bills, but we will have some discussion on some that we just can't get to an agreement on. Our goal is to continue to work on those which we disagree on as the process continues until these bills will potentially come to the floor. Thank you.
Thank you for that, Senator Summers. Representative Clara DeStitria.
Thank you, Madam Chair. Good morning, everybody. Like both of them have said before me, both the representatives, we have a hefty agenda today, and we know that a lot of these bills will still be a work in progress. So we're looking forward to the continued conversation. Thank you.
Thank you so much. I know work in progress maybe isn't everybody's favorite phrase, but that's what we do in this building. We continue to work together in conversation on these bills throughout the committee process and once they come to the floor, and we are committed to working together to do just that. I will say we're going to jump around a little bit on the agenda today, so bear with me if you will. We are going to begin with item number 11. Item number 11 is House Bill number 6669, an act protecting patients and prohibiting unnecessary healthcare costs. This is a JF to the floor.
So moved.
Moved by Senator Summers. Is there
Second.
a second? Seconded by Senator Anwar. This bill, I'm going for our summary and kind of overview. I'm going to turn it over to you, Senator Anwar.
Thank you so much, Madam Co-Chair. And if my voice is muffled or you don't hear me well, just signal me. Is it okay? Good. Okay. So this is a pretty extensive bill. This is a governor's bill, and it has a number of very important parts to it. And I'll walk you through a number of the parts, and I'll also share a little bit about some of the conversations we have had on parts of the bill.
Senator,
yes.
Senator, if I may interrupt you for just a second, a few of us are having a little bit of trouble hearing you. So if you can, again, use that outside voice, that would be great.
I'll come closer to the mic, and I guess my mask is not helping either. But the mask makes me look a little better. So that's why I'm wearing it. So I will go ahead with the bill. The 6669 has many sections to it. The first section is about having a drug discount card. This bill is about a cost of healthcare and transparency. The cost of healthcare has multiple parts to it. And pharmaceutical cost is a very big part in this. And this is the first part is trying to have a way of reducing the cost of medications through collaboration with other states. So there is bulk buying, bulk purchasing opportunities that would help reduce the cost of medicine. Individuals would be eligible to have a drug discount card, whether they have insurance or do not have insurance. This card would allow them to be able to buy the medications out of pocket at a low cost, and sometimes it would be much less than what they are going to be paying if they use their insurance. It is not part of their deductible, and it is off the insurance as well. So that's one part of the bill. Then the section 2 and other sections are a little bit about drug monitoring system. This body had created the PDMP, which was for controlled substances. And right now, the bill suggests that we need to expand the PDMP for all medications. And what that does is it allows medications as well as devices to be recorded and knowledge about them, so that the cost aspects and other aspects can be assessed and potential opportunities of savings can be evaluated in future. Section 3, 4, and 5 is about detailing of medications through the pharmaceutical reps. This includes academic detailing with looking at cost-effective recommendations and collaborating with the DCP and University of Connecticut for detailing process training, as well as licensure of pharmaceutical reps. And they're the bill is looking at guardrails around the interactions with clinicians, including the uses of vouchers for medications instead of samples through the offices. We move on to section 9, which is about identifying ways of looking at how through the rebate process and the spreading of the pricing process works for the PBMs. And this is looking at ways and opportunities to see if we can identify opportunities for reducing the cost of medications, which is felt that PBMs are contributing to. Go ahead, Representative McCarthy-Behe.
Senator Anwar,
Yes, sir. Yes, ma'am.
so I'm still having folks saying that it's tough to hear.
Oh, boy. Okay, so let me turn my camera off and I will speak. Perhaps the bandwidth will improve. Does this sound a little better?
Slightly,
Wait, I
but you may have to actually shout.
Wait.
Go ahead, Senator. We'll
let's see
try
if this
again. If
works.
not,
Can
I
you
can
hear me
pick up
now?
from there.
Representative McCarthy, Behe, started to jump in, but could it be volume on your end? Because we can all hear him on Zoom.
No, this does sometimes happen. The differences I can't explain. I'm definitely not a technology person, so that does happen. But here in the room, there are a number of folks who are having a little bit of a difficult time. So we'll try again, and if not, I'll pick up from there. Go ahead,
Okay.
Senator.
And I've adjusted my frequency to try and have selective information shared with like fellow colleagues. So, but hopefully this is a little better. I had my headphones before. Is this better or is it the same as before?
It's about the same.
It is about the same. Okay, so I will come closer to the computer and I will turn my video off. So I will speak a little slower and louder in where I'm at. And section 9 was about PBMs, the pharmacy benefit managers, and we are trying to see how we can impact the pharmacy benefit managers pricing by looking at the study and then spreading the price, looking at how they're spreading the price and the rebate procedures. Section 10 is about Office of Health Strategies role in the 10 prescriptions or so that they are going to oversee. This bill is going to adjust the criteria so that those medications can be studied, and there is improved transparency on the cost of those medications and the most commonly used medications. Section 11 is about the facility fees, and this is about the hospital-owned ambulatory surgery units and the facility fee that is charged in that situation. And this is, of course, one of the areas where there are some concerns that have been raised by the hospital association. But this is the section 11 is the one that looks at that component. And then there is section 12 looks at the CON, and it's more of enforcement of CON with civil penalties around it, and also giving more power to the Office of Health Strategies if anybody is bypassing the recommendations for the CON process, and it gives more teeth, if you will, to the CON process. Then another part is the section 16, which is the federally qualified healthcare centers. The bill in its current form is going to help the federally qualified healthcare centers with the 340B program. It is also expecting that the hospitals will be providing the information about their financial impact from the 340B program. So, Madam Co-Chair, it's a pretty long bill, a number of components in it, and some of them are very straightforward, and some of them require a little bit more work, and that's part of the conversation. So I'll stop here. I'm sure my colleagues have questions and concerns. Thank you.
Thank you, Senator Anwar. I think if I'm looking around, it was a little better at the end there for hearing. Am I slightly better? I'm getting some slight nods. Before I begin taking questions and comments, I'll just add, just the summary alone took us how many minutes? This is a very lengthy bill. It has a lot of provisions in it, and it will require a lot more work, a lot more conversation, a lot more bringing stakeholders to the table together to work through this bill as it moves forward. We are JFing it today, but I don't anticipate whatsoever that the bill coming before us on the floor will look the same as it does today. And with that, I will take questions from members or comments, discussion on the item. Senator Summers.
Yes, thank you, Madam Chair. This bill is a bill that there is something for everyone to hate. You can take a section. Myself and Representative Claire Desticcia spent a few hours with OPM, the governor's office, DCP this weekend to go over all of the issues that we see within this bill. There's certain sections that we would like deleted completely. Working in pharma and selling medical devices, myself and other people here in the past, we do not see how section 3 through 5 would ever work in reality. And section 17 is just a no-go. We feel that the hospital facility fee needs a lot more work with the CHA and others coming to the table, because it's not really apples to apples when you look at surgical centers versus centers that are governed by a hospital. There's different regulatory issues that you have. Also, the 340B program, I think it's well intended, but 340B is actually collapsing right now. It's a federal program. There is if you look online, it's ASAP 340B, where the pharmaceutical companies are coming together with the community health centers and federally qualified health centers to try to save 340B. And really, that's a federal program, so it doesn't belong in a state bill. So I am going to be voting no on this bill today. I think that it's problematic in so many areas, and I will continue to try to work to make it better than it is now, but I am a strong no on this bill today. Thank you.
Thank you very much, Senator Summers. And I think through the course of the discussion, we're going to learn a little bit more about some of the questions, concerns that people have We've heard also from others in the community, various stakeholders. So we'll continue the conversation. Representative Clara DeStitria.
Thank you, Madam Chair. And to echo Senator Summers' comments, this bill does truly have a lot of bad parts in it. There's a lot of work that needs to go into this bill to make it better. The goal of this bill is supposed to be to bring down healthcare costs. I don't see that achievement happening. So I appreciate the hard work that everybody's put into this. I'm looking forward to a heartier conversation trying to fix many, many issues in this bill today. Thank you, Madam Chair.
Thank you very much, Representative Clara DeStitria. Representative Steinberg.
Thank you, Madam Chair. I would describe this bill as ambitious. It certainly tries to cover a lot of different areas. I think many of these areas need to be tackled, but it's a bill that I will take the chairs at their word is going to require a lot of work before it reaches the floor. I'm just going to highlight one section that has drawn the responses from the hospital industry as it relates to facility fees. I want to go on the record as saying I don't like facility fees, and I like some of the restrictions that we put in place over the years. But I am sensitive to the fact that based upon recent data, and I know there's conflicting data, a number of hospitals in the state, which under normal circumstances struggle, are still recovering from the pandemic and are facing a lot of increased costs. And I'm concerned that this will not make it easier for them to get into a position where they remain sustainable. One suggestion I had is I noticed that Section 11 has an active date of July 2023. We might want to consider pushing that back a little bit in cognizance of the current circumstances the hospitals are facing, and look very carefully at how we're going about defining and assessing these facility fees as we go forward. Again, I'm in favor. Hearing an echo of myself is not good. I'm in favor of the concept of limiting facility fees. I'm not sure this is the way to go about it. And this is just the tip of the iceberg for me. I could probably quote a half dozen sections where my eyebrows were raised and I'd like to see a lot more work. So I will vote in favor of this bill because it is a consequential bill, but I sure hope it changes a lot between now and the time we see it on the floor. Thank you, Madam Chair.
Thank you, Representative Steinberg. And as the former chair of this committee, I certainly appreciate your remarks and have appreciated your wise counsel in the course of working on this bill. Other comments, questions? Representative Foster.
I'd like to briefly echo and hope to sort of expand on following up on something that Representative Steinberg shared. I have concerns about the hospital fees specifically as they relate to the shift of services to ambulatory care centers from our small community hospitals. I have a concern that perhaps this cost shift in the way that we are doing care, hospitals are doing ambulatory service care, if we change the potential profit margin on those procedures, that we are going to further drive small community hospitals and the services that they provide down, because those outpatient ambulatory care procedures can be profit drivers for these facilities. So I'm a little nervous. Our healthcare organizations are incredibly regulated, and they should be. But when we pass legislation that has economic impact, I'm always reticent of the unintended consequences of shifting the markets. And I see a huge shift in our community of care being provided outside of our traditional hospital care systems in a variety of different settings. And I'm worried we're going to hasten small community hospitals leaving or decreasing and diminishing services if we change the way that they can provide ambulatory care services. And I think that the sort of understanding what could be potential unintended consequences of shifting these markets is important. And I don't think I've been well convinced yet that we can, but that the rightful protections and against unintended consequences have been taken. I'll be supporting this bill out of committee today. And I am eager to see and learn how we'll make sure that we protect our hospital system moving forward. And that's just one component that I am sort of interested in hearing and learning more about as we move forward. But I've been hearing a lot in my community about closing of maternal care centers, labor and delivery at our local hospitals. And even as we talk about expanding birthing centers in the maternal health bill, I'm worried that if the small community hospitals don't have OBGYNs on staff in labor and delivery, that there's not going to be a local close referral. And I do think that this sort of shift in how practices are being provided on campus versus off campus is a way to increase sustainability of our small community hospitals. And I think that this bill might have unintended consequences to that marketplace. So I appreciate the opportunity to voice my concerns. Thank you, Madam Chair.
Thank you for that, Representative Foster. And certainly we will be talking more about that issue specific to maternal health very shortly. Representative Kennedy.
Thank you, Madam Chair. As Senator Summers says, there's a lot in this bill, but so I represent Milford, and Milford Hospital, which I still call it, is my community hospital. It's now Yale Bridgeport Hospital at Milford campus, but it's still Milford Hospital that employs so many people. I just have so many concerns with this bill. I will be voting no today. And I will take leadership at their word that we will make some changes to this bill that will strengthen it. But for today, I'm going to be a no. Thank you, Madam Chair.
Thank you, Representative Kennedy. And you'd think I'd never run a hybrid meeting before. Senator Anwar.
Thank you
that I
so
missed
much,
you there.
Madam Co-Chair. Thank you. I just want to make sure that I also communicate with my colleagues that this is a big bill, and like Representative Steinberg has said, that this is an ambitious bill. There are good parts to it. There are coming from a place of trying to control the cost of healthcare and increasing transparency. But as we are looking at ways to address that, we will need a lot more conversation on this. I see from your you can't hear me well, can you?
It's actually better.
Oh, it is better. Good. Okay. So what I was saying is that we will be working on this bill. The bill in its current form is okay to JF, but it's in the current form should not go beyond JF, because we will be working with our ranking members and other colleagues to make sure that we are able to protect any unintended consequences and make sure that we are able to achieve the intended consequences. So I just wanted to make that comment. Thank you, Madam Co-Chair.
Thank you, Mr. Chair. Senator Rahman.
Thank you, Madam Chair. I don't know how many committee you're serving. I see you all over everywhere. So thank you for serving. So I am supporting this bill. I just want to echo the Senator Summers saying there's so many things, a lot on this bill. We are all agree with that. There's no doubt about it. But important part on this bill is supporting the, our community will reduce the, healthcare cost, and will support the hardworking people who can afford to pay the healthcare. And this is why I'm supporting this bill. Thank you.
Thank you, Senator. Our health systems and our healthcare providers have been under tremendous strain over the past few years, as have our families. And I think what we're all saying here today is that we are committed to doing what we can to assure that our systems are providing care in ways that are effective, that are cost effective, and hopefully even more accessible for the people of our state. But we have some concerns, and I think while we may have different votes today, this is a pretty clear message that this bill will continue in conversation as we move forward. Representative Cook.
Thank you, Madam Chairman. And I don't know if there's a better way to say I agree with everybody with what they said, but I do also want to caution that if we put more mandates and requirements on our departments, which I believe is vitally important to look at what we do and how we do it, we also need to make sure that we can backfill those requirements with staffing in their departments and their agencies. And I know that we are not the appropriations committee nor the finance committee, but we are the policy committee. But I think it's so vitally important that if we put things in place that are going to require more reporting, more outreach, you fill in the blank of all those other things, we have got to be able to backfill that with a staffing to get that done. If not, we are just spinning our wheels for no reason at all. So I will entrust the fact that we move and make great change in a very long bill of 47 pages. But I also think that it's extremely important that we follow it all the way through, because if we do put some of these things in place and we cannot help them with the supports that they need, also the supports maybe in the communities that they might need, we're just doing things for no reason. So as much as we have great intentions, unintended consequences for me always tend to wheedle their way through. So I would really hope that as we move forward to change this legislation to make it better, we think about that as well. Thank you.
Thank you, Representative Cook, and for the reminder to talk with our friends on the Appropriations Committee. I'll be calling you later, folks. So if there are no other comments.
Madam Chair, I'd like to make a motion to start a consent calendar.
And we absolutely can consent for other bills. I think this one, I believe, yes, wonderful. So we have, thank you so much. Representative Clara DeStria, I very much appreciate your forward-looking thinking. So we have a motion to begin a consent calendar. Is there a second? Seconded by Rep. Zupkis. So we will have a consent calendar. That's wonderful. If there's no further discussion, no other questions on this item, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers,
Senator Summers votes no.
Representative Clara DeStria,
Representative Clara DeStria votes no.
Representative Belton, Representative Belton votes yes. Representative Burgess Givallo,
Representative Burgess Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott,
Rep. Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kitt,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes.
Representative Mara,
Representative Mara votes no.
Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slatt votes yes.
Representative Steinberg, Representative,
No.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Tercia, Representative Wielander,
Representative Wieland votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Cabrera, Senator Gordon, Representative McCarthy, Representative Tercia. Thank you, Madam Chair.
Thank you, Madam Administrator. Representative Jenga.
Thank you, Madam Chair. I would just like everybody to know that Representative Terziak, I just found out yesterday, is having an operation on his back today.
Okay, thank you, Representative Jenga, and we will all keep the good representative in our best wishes as we continue our meeting today. Thank you, Madam Administrator. Next, as I said, we'll be jumping around just a little bit at first. So we are going to go to item number 2. This is Senate Bill 986, an act protecting maternal health. This is a JFS to the floor with an LCO of 6209. May I have a motion? So moved. Moved by Senator Kushner. Is there a second?
Second.
Seconded by Representative Kitt. The bill before us today is establishing licensure for birthing centers in our state. It's establishing an infant mortality review program within DPH and then a committee within that program. It's also establishing a pathway for doula certification and a program administered by DPH. It's establishing a midwife working group. And by the way, it's a voluntary doula certification program. It is also requiring Office of Early Childhood together with some other folks to create a universal home visiting program. The S language changes in this bill are simply changes to the membership of that infant mortality review committee, just designating specifically a physician licensed who practices neonatology and then a physician assistant. It also adds the commissioner of the Department of Mental Health and Addiction Services or the commissioner's designee. Are there comments or questions on this bill? Representative Zupkis.
Thank you, Madam Chair. I do have some questions. I like probably 50% of this bill and struggle with 50% of it. My first question is I cannot say it, but the CMV, that there was a newscaster that came and talked about her granddaughter, and we passed a bill about that. Will the birthing centers screen for that?
Thank you, Representative Zupkis. Well, we certainly are looking at changing the requirements. So currently there is no universal screening requirement, but my understanding is our birthing centers would be following all law. I don't know if Rep Kushner, if you have any insight into that at all, but my understanding is that the birthing centers will be, following all laws and procedures and standard practices.
Okay,
Madam
so at this time,
Co-Chair.
no, but we did pass that bill, so they would have.
Well, we did pass it out of committee, so
Right.
we'll see how we
Okay.
do with that going forward.
Thank you. My second question is, in listening to a lot of the testimony, the population really that is going to serve, that this is going to serve. One of my questions in asking one of the people that came to testify was about paying for this. How are they going to pay for it? Is Medicaid going to cover this? Do we have any answers on any of that?
So I'm not going to be able to give you a great answer about that right now. Senator Anwar may be able to add something here for us, Senator
Yes,
Anwar.
these sites, first of all, the important thing about the sites is the cost of care is going to be much less than what is in the hospitals. That's number one. Number two is that if somebody has insurance or Medicare or Medicaid, they would be able to pay for these sites as well, birthing centers. Thank you,
Senator,
Madam.
did you say so it would be covered under Medicaid and insurance? I couldn't
Correct.
really hear you.
Yes.
Yes. Okay. Thank you. My second question is, or third question is in section 2D. It says on line 165, the commissioner may adopt regulations, and such regulations may include all of these things. To me, if this is a place where childbirth is going to happen, we want to protect mothers and babies. I'm not a big government regulation person, but may and shall, there's a big difference there.
Thank you, Representative Zupkis. I'm going to turn it over to Senator Kushner.
Thank you. One of the things I noted in the testimony and also from my conversations with the birth center, and by the way, I'm sure you heard me say the birth center in Danbury has operated for 26 years and it's been very successful, but they are accredited by a national body that does accreditation for birth centers, and they have very stringent requirements so that they are actually meeting really high standards already. And I believe that the bill references the accreditation body as a body that would have the professionalism and the experience nationally to be able to really provide those assurances and to make sure that our birth centers are accredited centers.
So an outside, that body would oversee them versus DPH.
I think DPH would take its guidance and would cooperate and collaborate with that accreditation service. That's been my understanding is the way this would be approached, and it would be required that they be accredited.
Okay.
Just sort of like if you think about universities that are accredited, we really want that national accreditation.
Thank you. And then my
Representative Zupkis, if I may, I'd also like to turn it over to Senator Anwar as well.
I think Senator Kushner may have answered the question that Representative Zupkis was and had asked. Is that accurate? That you find the question answered?
Yes, I think so. You go ahead. Please proceed, Rep. Zupkis. Senator Anwar, you're correct.
Thank you. I don't really know what he said, but thank you. And my last question, I guess, is there a CON needed for birthing centers?
So two things. One, just going back to your earlier question in terms of coverage, the Medicaid coverage, as we sometimes do, calling for a lifeline, learned yes and confirmed that yes, that is covered. And a certificate of need is not needed for the birthing center.
That is a concern of mine because there are lots of places that need CONs, and this is so they can prove that this is of a need, and they will be evaluated, monitored, and those are things that I believe that birthing centers should have. I think they should be evaluated by DPH. I think they should be monitored. So by not having a CON, understanding there's this outside group, that is still of a concern of mine. So thank you.
Thank you, Representative Zupkis. I will give Senator Kushner a moment to comment. As you can see, Senator Kushner has been a champion for this, had a bill of her own as well, and is helping to lead this conversation. So Senator Kushner.
A couple of things. I think that, we've all had some experience with CON applications this past few years, and it can be a very lengthy and difficult process. I don't disagree that CONs are necessary. I wish that we could staff that agency fully and make sure that we could get them done quickly. But aside from that, I think that the situation with the birth center is a bit different than some of the operations that require CON, hospitals, other therapy operations that are coming into the state. A birth center is really making available for women an opportunity to have a baby in a different setting. And I don't think it's a question of needing a certificate of need, of filling a need in a particular area. I know that we've talked about how we have some maternity deserts in our state, and a birth center could potentially fill a void that's very important. And I don't disagree with that. I think there's some importance to that, but it's not simply for that reason. It is for women to have the choice to have a baby in a different environment, not being in a hospital environment. And these are environments that have been found historically to be safe if they are done properly, and if they, are, I do believe that the Commission for the Accreditation of Birth Centers nationally is the organization that has made sure that they're professional and that they're operating safely.
Thank you, and I appreciate that. I might still disagree a little bit with that. And, I just, with these deserts that we talk about, I understand the importance of giving women choices where to go, the need for it. That's why I really like the doula part of this bill. However, those are still somewhat concerns. We regulate everything in this state under all the departments, and to not do this, I have a little bit of a concern with, but I appreciate where you're coming from. And what I would not want to happen is maybe some big firms or something coming in, opening birthing centers everywhere. So that's why I think it's important for that to be evaluated and overseen by DPH. Thank you.
Senator Kushner. I do want to clarify, I do believe that DPH will be, CON is different than DPH regulating and overseeing. And I do believe that in our state, we expect DPH to be the regulatory body, to be the body that oversees these birth centers. And, I really appreciate the role of DPH in recent years. I think this would have come forward earlier had it not been for COVID. I know they were very interested in coming to Danbury and visiting the center. And then because of COVID, everything shut down. And so we've been a little slower to get that back up and running, but I don't disagree that DPH will have a very serious and regulatory role here. Thank you, Senator Kushner, and thank you, Representative Zupkis. I think this is an exciting conversation and opportunity, and we all want to make sure that we get it right, because we want to make sure ultimately that those people who are giving birth and those new babies are all safe. So Representative Clara DeStitria.
Thank you, Madam Chair. Excuse me. I just want to get for clarification for people that may be listening or watching out there. How would this proposed bill affect a hospital that currently has a birthing center within its campus?
So thank you for the question, Representative Clara DeStitria. It's my understanding that the hospital and the procedures that they would need to go through in terms of licensing and all that would not be impacted by this bill, that this is for the separate birthing centers that would go through a different process and a different type of licensure process.
Thank you, Madam Chair.
Representative Kushner. Senator Kushner, there we go. That's okay. There are a lot of representatives who think that being a senator is a demotion. I hear that all the time. I just want to say there are a few things in this that I hope that we would continue to work on, because I think it's a very good bill, but I also think there are a few things we could do to make it even better. And one example, and it goes to the question that was asked about the hospitals, is that we currently have a maternity hospital licensing. This bill would eliminate that license. And I'm not sure we want to go that far yet, because even though we don't have maternity license, hospitals licensed, birthing centers should not be licensed as maternity hospitals. That's a separate license in a different situation. But I do think that that's an example of something we might want to retain. So I hope we'll continue to look at some small tweaks that we might make in this bill that would ensure that we're doing our very best. Thank you. Thank you, Senator Kushner. I appreciate that comment. I think we did hear in testimony a few different ideas from the folks who've been doing this work for quite some time, and look forward to working with DPH on this. Senator Anwar.
Thank you, Madam Co-Chair. I just wanted to mention one part of this bill, which is arguably one of the most important part of any bill that we may see during this session, which is a universal newborn nurse home visit. This is going to be a shift in how we are taking care of the children in our state and identifying the needs of the children and triaging it at the appropriate level. This is going to be one of the most important parts of this bill, which is exciting, and it's going to be a generational change of providing service early in the course of the child's well-being. And I just wanted to highlight that, and that part of the bill excites me quite a bit as well, as you can see. Thank you.
Senator Anwar, I thank you very much for those comments. The opportunity for every new parent with a new child to have a visit and have support is an absolutely thrilling opportunity, especially given what we know about creating foundations for our newest Connecticut residents. Senator Marks.
Thank you, Chair. Through you, I just want to echo what Senator Anwar just said, and I have had the privilege to be one of those nurses that goes to the homes of newborn parents back in the old days when they first cut down that moms and babies could only stay for 24 hours in the hospital. They then started to send out, the insurance companies would send out a MCH nurse. And you get so much education in the hospital that you're not even thinking, but then to have somebody sitting in your living room where you don't care that you're postpartum, you know how we all feel if you're a woman, and that you really can do some great teaching and really good assessment, and especially with postpartum depression and lactation, it is just so wonderful. And if this actually happens, this program, it will save lives, and it will just make that bonding time so unique and even that much better. So thanks, Senator Anwar, for bringing that up. And I will be supporting this bill.
Thank you, Senator Marks. Seeing and hearing, Rep. Kennedy.
Thank you. Thank you, Madam Chair. I just have a question on lines 269 through 271. States on or after January 1, 2024, the Commissioner of Public Health shall not grant or renew a maternity hospital license pursuant to this section. Could you tell me how many hospitals will be impacted by that? For you, Madam Chair.
Thank you for the question. That's the section that Senator Kushner was just referring to. So it's a separate licensing category, and the idea was in the bill would be to repeal that and go specifically with the birthing center process. As we heard in testimony, there are some who think we might want to leave that in place for now, but I think we're going to have to talk with DPH and the folks at the birthing centers to see what makes the most sense for that.
Thank you. I appreciate the question, or the explanation a second time. Thank you, Madam Chair.
Thank you. Rep. Foster to be followed by Rep. Carpino.
I'm really excited to be speaking in support of this bill today, and I'm looking forward to seeing what we can accomplish this session to address this. I am the mom of a preemie, and the March of Dimes annually puts out a national report card on the state of infant mortality and premature birth in the country. And although Connecticut is not the lowest on the list, we have many states ahead of us, including Vermont, that receives an A annually on their premature birth. But I think that I'm eager and incredibly nervous to find out what our infant mortality review panel can find. As a scientist, I know that data is the only way that we can ensure that we avoid unintended consequences with infants. But as a mom, and soon to be mom again, I find myself eager to learn what we can from what's happening, and when things don't go well and when things go as intended, and using that data to make sure that we don't repeat negative consequences that have unintended outcomes for moms and babies. There are a variety of different bills that we have before us this session that I think are prioritizing both mom and infant, but this bill I think can be a really important shift to prioritizing data-driven approaches. And so I asked this question in the public hearing of the good commissioner of the Department of Public Health, but I'd urge this committee to consider first, as we review fatality, considering what could be done that's avoidable. I know that that's the intention, but I know that there's a lot of infants born prematurely every year. Thank goodness the vast majority of them survive. But those infants who have unintended and lasting consequences related to their premature birth should be considered, because birth outcomes are not just about survival. They're about every experience that mom and baby have in the NICU setting, in the hospital-based setting, and the ways that we can ensure that moms and babies have the best possible outcome is something that I think in everything that we do, and the Department of Public Health prioritizes, should be on the top of their list. So I am eager and excited to see what can happen here moving forward. And I'm hopeful that this means that when we start evaluating the March of Dimes scorecard in the years that come, that Connecticut will be amongst Vermont, perhaps getting an A, as opposed to our current score, which is a C. So I look forward to seeing improvements.
Thank you for those comments, Representative Foster, and I think that's something to consider as we move forward in this conversation. Representative Carpino.
Thank you, Madam Chair. This question is to you or to whomever you think could best to answer this. What is the average length of stay for a woman who chooses to deliver in a birthing center? Because we talk about women having the amount of time they need in a hospital, and I just want to make sure that I'm clear.
I don't know the average length of stay for women in a birthing center. In part, we have one currently operating in Danbury at this point. But my understanding is that this option to be available for persons who are giving birth is really designed for folks who are really in that 24 to 36 hour time period, not for those who would need an extended stay for whatever reason. So I don't have an answer, though. That's my understanding of what the target is.
And thank you. And I appreciate your honesty. I chose to have my children at Hartford Hospital and had a wonderful experience both times, with both of them being high risk. So I strongly believe in a woman having a choice. I have concerns with the language of this bill, though. So while I hope to be able to support it, should it come to the floor, I can't support it now. I remain committed to helping work through this, but sometimes we get a little over ambitious in this committee, and I just want to flag it with a note to make sure that we have the ability to work through all the details before it's the 11th hour. Thank you, ma'am.
Thank you, Representative Carpino, and I look forward to talking more with you about that. I think we will be having ongoing conversations on this one, as with most of our bills. Are there any other comments, questions? Seeing none, Madam Administrator, would you kindly call the roll?
Senator Anwar. Representative McCarthy.
Anwar votes yes. Senator Anwar votes yes.
Thank you. Representative McCarthy Vaihe.
Representative McCarthy Vaihe votes yes.
Senator Kushner.
Senator Kushner votes yes.
Senator Marks.
Senator Marks votes yes.
Representative Parker. Senator Summers. Representative Tardis Dietrich.
No. Representative Claire Distretria votes no.
I'm sorry,
Representative Belton.
Madam Administrator, I thought you said Senator Cohen, so I didn't hear you. Summers votes no.
Thank you. Representative Belton.
Representative Belton votes yes.
Representative Berger Givallo.
Representative Berger Givallo votes yes.
Senator Cabrera. Representative Carpino.
Representative Carpino votes no, ma'am.
Representative Cook.
Representative Cook votes yes.
Representative Dauphiné.
Representative Dauphiné votes no.
Representative DiCaprio.
Representative DiCaprio votes no.
Representative D'Amico.
D'Amico votes yes.
Representative Denning.
Representative Denning votes yes.
Representative Elliott.
Representative Elliott votes yes.
Representative Foster.
Rep Foster votes yes.
Representative Django.
Representative Jenga votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Gordon, Representative Cabras DeGraw,
Representative Cabras DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes.
Representative Mara,
Representative Mara votes no.
Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wieelander votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Cabrera, Representative McCarthy, Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. The votes will be held open today. We're going to work on the time for you. Depends how we do today. So I'll get back to you on that in one of the upcoming votes. So I appreciate your patience. We're going to go next to item number 1 on our agenda. And that is Senate Bill number 171, an act allowing pharmacists to prescribe birth control medication. This is a JFS to the floor, and members, please note this is LCO number 6230. May I have a motion? Moved by Senator Summers and seconded by
Second.
Representative Clara DeStitria. This bill will allow a pharmacist to prescribe emergency or hormonal contraception to patients ages 16 or older if the pharmacist takes a few different actions, completing an accredited educational and training program, reviewing the most current version of the CDC's medical eligibility criteria for contraceptive use, completes a patient screening document before dispensing the contraception, and counsels the patient on what the patient should monitor and when to seek medical attention, notify the patient's primary care provider, or if there is none, the patient, her, himself, or themselves, and provides the patient document outlining age-appropriate health screenings. It does require documentation to be kept, and the S language before us removes lines, hang on one second, 70 to 74 regarding moral ethical objections. Is there discussion on this item? I saw Representative Linehan to be followed by Rep. Cook and then Rep. Gilchrist.
Thank you very much, Madam Chair. During the public hearing, I think I was pretty vocal about some of my concerns. And for those who aligned their thoughts with mine, I just want to kind of give an idea of where I am with this. Section 1-1B, it does say that an appropriate medical screening is required. However, it does not specify where and who is putting that screening together. So essentially it says, hey, you must do a screening, but it doesn't say what it's screening for. I just think that it's not enough. But I do believe that I don't want perfect to be the enemy of the good. So I think that it's important that we do get this out of committee, but I would really like that to be looked at. It does require in sub 2 the U.S. medical eligibility criteria, and it requires that pharmacists look at that. And what that does is it says what these medicines are good for, the contraceptions are good for, and who has a contraindication for it. However, it relies solely on the patient's understanding of their medical history for those contraindications, as pharmacists don't actually have access to the direct medical records of those patients. So those are my concerns, and I'm hoping we can move forward and have further discussions. But I really do believe that this bill should pass. If I was going to get my number one, have this bill as perfect as I want it to be, it would really be that because these things are covered by telehealth, that it should be a second refill subscription or prescription, sorry. And then furthermore, you could do that through the pharmacist, but they would need to see a doctor or at least have a telehealth visit first. I understand that that is not in this bill. I would like to see that, but I don't think that that would ultimately have me not support it. So I just wanted to be vocal about what my concerns were. But again, I don't want perfect to be the enemy of the good, and I am absolutely supporting this today. So thank you for the opportunity to explain that, Madam Co-Chair.
Thank you very much, Representative Linehan. Representative Cook, to be followed by Representatives Gilchrist and Rader.
Thank you, Madam Chairman, and I echo the comments of Representative Linehan. I do think that there needs to be some original conversation with a physician before you go full board on birth control for a variety of different reasons. So I would really hope that when we look at moving this, that is something that we can do. I think that's vitally important given any type of underlying conditions and side effects and medical reactions to prescriptions. That being said, I want to make something else just known for the record. So in this piece of legislation, is this a mandate that all pharmacists must offer the prescription of birth control, or is it an opt-in or opt-out type of a situation? Could you clarify?
Yes, thank you. The language here, emergency contraception, just to be clear, different than hormonal, is available over the counter. And so that's here, separate from hormonal contraception. We did in the S language remove the ability for a pharmacist essentially to opt out. As was pointed out to me in discussions earlier, if a doctor is prescribing a medication, we don't have situations where the pharmacists are able to opt out of a medication that's been prescribed by a physician. So we felt that it made sense to remove that in this bill as well.
Thank you, Madam Chairman.
Thank you, Representative Cook. Representative Gilchrist, to be followed by Representative Rader.
Thank you, Madam Chair. And I have a question and then a comment. My question is either to yourself or to the proponent of the bill. Wondering, does this in any way change the fact that emergency contraception is currently available over the counter? And how does it interact with that current law?
And I'm certainly happy to give Senator Summers an opportunity to respond as well. But no, this does not in any way restrict, prohibit, limit the availability of emergency contraception as an over-the-counter option.
Wonderful. And then my comment is that I think a lot of work has been done on this bill, and I know there's another bill working its way through the process. So I look forward to continuing the conversation and working this forward. I support expanding access to birth control and emergency contraception. I just want to put on the record that I do not support in this bill the provision of age 16. Currently in the state of Connecticut, we do not have an age restriction for birth control or for emergency contraception. And so going forward, I'd like to see that piece removed. But today I'll be a yes. Thank you, Madam Chair.
Thank you, Representative. Senator Marks.
Thank you, Chair. Through you, I just want to say I do support this bill. And you just, the side effect of not getting birth control or not being able to have birth control is an unwanted pregnancy. And there's many women in this room, and having an unwanted pregnancy is something that I don't wish on any woman. So anything we can do to make birth control more accessible, I agree with. Hormonal birth control has been around for a very, very, very long time. We all know that there's a risk if you smoke. And so you do an assessment and you ask if you smoke cigarettes. But still, the side effect of having an unwanted pregnancy should outweigh anything. And just imagine if you're a young woman who had a physician where they lived for years, and then you move, you relocate, you're unable to get an appointment with an obstetrician, and how wonderful to be able to walk into a pharmacy because, you know, the prescriptions went out and you need to go see your doctor. And we don't need pap smears every year. Like back in the old days when I was young, we had to have a pap smear every year. So anything to improve access to birth control is so important to me. And I will absolutely be voting for this bill.
Thank you, Senator Marks. Senator Summers.
Yes, thank you. I recognize and I'm hearing some of the concerns that people have raised. I will say that pharmacists are trained specifically now in birth control. 22 other states have adopted this type of law. And there is a great study that I will share with anybody who reviewed the pharmacists and their dispensing practices. And it showed that when pharmacists, after they fill out, the patient fills out the assessment form, if there's any question, they will refer that patient to a physician, i.e. they will not dispense the medication. And that happened in Oregon about 7% of the time. When they looked at the health assessment that's filled out versus the patient's record, when they were able to compare them, they matched 97% of the time. So I am confident that our pharmacists are well-trained. They are medication experts and professionals, and I have full confidence that they are able to dispense this medication that's been on the market for 61 years safely and effectively, and would do nothing to cause any harm to a patient if there was any question whatsoever. So I'll be happy to send that study to everybody on the committee so they can look at that. Thank you.
Thank you, Senator Summers. Representative Palm, to be followed by Rep. Cook for the second time.
Thank you, Madam Chair. I appreciate the perspective that Senator Summers just provided to all of us. And there's no doubt, I don't think there should be doubt in anyone's mind that physicians certainly stepped up during the pandemic and beyond, and often fill the gaps when it's impossible to find or get an appointment with a physician. So I am a solid yes on this bill. I think this is another proud day for Connecticut in accessing and protecting women's reproductive rights, and I'm glad to vote yes on this bill. Thank you. And I appreciate the compromise that was made on the language.
Thank you, Representative Palm. Representative Cook.
Thank you for the second time. So I have one clarification question and then just simply a statement. So my clarification question was, if a pharmacist or pharmacy chooses not to participate in prescribing birth control, do they have to prescribe birth control, or can they opt out of the option of offering that service?
I'm not prepared to answer your question. I'm not familiar with a pharmacist or pharmacy who currently is able to do so, but I'm going to have to get back to you on that one, Representative Cook. If there's someone here who is able to provide an answer, I'm happy to cede the floor. Representative D'Amico, I will recognize you.
Thank you, Madam Chair. I don't know if this is helpful or not, but I'm looking at lines 23 and 24. Pharmacists certified in accordance with the provisions of this section may prescribe in good faith an emergency contraceptive, and so on and so forth. So does may answer the question?
No.
That's my contribution. Thank you, Madam Chair.
Thanks, Representative D'Amico. I think we're going to have to get you a fuller answer, Representative Cook. I think the emergency contraception is also separate from the hormonal.
I
So-
believe it is separate. And so I'm not speaking of the emergency contraceptive as much as I am the hormonal conversation. And although I understand that birth control has been around for many, many years, and I have 2 daughters, I've been there myself. And so my situation is not that I don't respect the need or the understanding to make it accessible. I do, but I also know that some children, and I say children, anybody under the age of 18, might not know all of their medical history or their medical conditions or their family's medical conditions. And in some cases, people have died or have included heart attacks, strokes, blood clots, and liver tumors from being prescribed birth control. I'm not saying that that is often, I'm saying that that is rare, but I'm saying that I do believe that there must be some conversation with with a physician to ensure that if you are of a certain age, you might not have all those answers. I'm 53 years old and I still call my mom for medical history in my family. So I want to be very cautious as we move forward. I understand the need and I understand the desire, and I'm definitely not putting into the same parallel the plan, morning after pill, if you will. That is not at all what I'm talking about. I'm strictly talking about the hormonal birth control pills, and that is where my concern is. So thank you.
Thank you, Representative Cook. And I may have gotten ahead of myself. The bill language itself is indeed, as Rep. D'Amico pointed out, permissive. I, was thinking of other situations in statute, but for this bill, that's the language that we have before us. Senator Anwar.
Thank you, Madam Chair. I just wanted to make a comment that I wanted to echo what Representative Cook has said. We need to make sure that these medicines are safe for some of the specific group of patients. The challenge is that I understand that we need to improve access. I just want to make sure that it's worthy to mention in the conversation. I will vote yes for the bill, especially after the changes. But it's important to note that if somebody is at a high risk for developing clots and they have a family history of clots or they have had clots in the past, they may have increased risk. So it's worthy to make sure, and that risk is better addressed by a clinician, and pharmacists are not clinicians and pharmacy techs are certainly not clinicians. So I just wanted to put that in the record. Thank you so much, Madam Chair.
Senator Summers. Thank you, Senator Anwar.
Yes, and I appreciate everyone's comments. I will just remind everyone once again, the pharmacist has to be trained on the birth control pill. They have to be trained on the contraindications. Obviously, we all know here that it causes clots. It's been around for 61 years, or it has the potential to do that. So if a 17-year-old came into CVS and dealt and talked to a trained pharmacist, filled out the intake form, I am sure there would be a conversation between the pharmacist and the 17-year-old if there's a history, if they may not know. Again, the pharmacist has the ability to say, I'm not comfortable, I'm going to refer you to maybe our Minute Clinic, and you can see an APRN or an MD that might be working there. And that has happened in 7% of the cases that 22 other states that have this without any adverse reactions or problems have had. So there is built-in safety net there. And just to respond to Dr. Anwar, no one is saying that pharmacy techs are the same as a physician. But I do think that it's important to recognize the impetus of this bill for all of us here is to provide better access to birth control for women and more choice for women in the state of Connecticut, especially in those areas that we have a contraceptive desert. And as Senator Marks has pointed out, the consequences of not being able to access birth control really raise the stakes as far as choices that women have with an unplanned or unwanted pregnancy. So I do think that this is a good bill. We have the history of 22 other states that have done this. And I think that we can go forward with it and make sure that people are safe by the training requirements and the intake forms. And I do appreciate everyone's input because it is really important that we make sure that we do this correctly. So thank you.
Thank you, Senator Summers. Representative Kit.
Thank you, Madam Chair. I just want to say that I hear the concerns of Representative Cook and Senator Anwar, and I too share those concerns. And initially I was against this bill, but after listening and reading and doing more research, I've come around, especially around the issue of, say, minors who might not know their medical history, their family's medical history. That's not going to change if they go see a physician that is not intimately involved, doesn't know the family's medical history. So say a 16-year-old doesn't want to go to their family physician, doesn't want to go to the pediatrician, goes to a clinic somewhere to see a physician, they're still not going to know their parents' medical history. There is still a danger that if they get pregnant, that medical condition that puts them at risk for clotting from hormonal birth control is going to pose the same risk if they're pregnant. So the risk is still there regardless of whether or not they see a physician, if they get pregnant or they take the hormonal birth control. It's still an increased risk for developing those clots. I think it's more important that we do increase access to hormonal birth control and contraceptives in these reproductive deserts. And so that, for that reason, I am now supporting this bill. Thank you.
Thank you, Representative Kit. Seeing and hearing no other comments or questions, Madam Administrator, would you kindly call the roll?
Senator Anwar, Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers,
Senator Summers votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Berger Javallo,
Representative Berger Javallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Jango,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
I need to see you on camera, please.
Representative Mara votes yes.
I'm still not able to see you. I'll come back to you in a minute. Representative McCarthy,
Thank you.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan, Senator Slack,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Anwar.
Senator Anwar votes yes.
I need to
Senator
see you on
Anwar
camera.
votes yes.
Thank
twice.
you. Senator Cabrera, Representative Elliott, Representative Mara,
Representative Mara votes yes.
Representative McCarthy, Senator Rahman, Senator Slack. Thank you, Madam Chair.
You all set, Madam Administrator?
Thank you.
Thank you so much. Our votes will be held open until 5 p.m. today. And as Senator Anwar said at the beginning, he is juggling public health and healthcare providing as a doctor today. So he will be in and out a little bit, attending to patients. So next, we're going to go to item number 7 on the agenda. Item 7, this is House Bill number 5197, an act allowing emergency contraception to be sold and dispensed via vending machines located at institutions of higher education. And this is a JF. May I have a motion? Moved by Representative Clara Destitria. Is there a second? Seconded by, was that Senator Summers? Was that you? Thank you. Wonderful. It has been moved and seconded. This bill would permit emergency contraception to be sold in vending machines located on higher ed campuses and owned and operated by a business that sells emergency contraception and has a DCP, Department of Consumer Protection permit for vending machines. Anyone who is not a licensed pharmacy must apply to DCP to obtain a permit, and the individual vending machines must be registered with DCP. Anyone who violates this provision is subject to a fine of up to $1,000. Are there questions or comments on the bill? No? Okay. Well, seeing no questions or comments, Madam Administrator, would you kindly call the roll?
Senator Anwar, Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clara Destitria,
Representative Claire Destitria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Burgess Javallo,
Rep. Burger Javallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Cabras DeGraw, Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
thank you. Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perella,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Kushner, Senator Anwar, Senator Cabrera, Representative Elliott, Representative Foster, Representative McCarthy, Senator Rahman, Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. And again, votes will be held open until 5 p.m. today. Next on our agenda, item number 8, House Bill number 5902, an act requiring food allergy awareness in restaurants. This is a JFS to the floor, LCO number 6176. May I have a motion?
So moved.
Moved by Representative Kitt. Is there a second? Seconded by Representative Welander. This bill requires certified, there's S language on this bill, and the S language that we have before us will require certified food protection managers to complete a DPH-approved food allergen awareness training program required under the state's model food code. That new FDA food code went through regs review in January, and DPH is in the process of rolling that out. The bill will also require the food protection managers starting July 1st to include food allergen awareness as part of staff training and establish guidelines for staff interactions with customers who have food allergies. It will require food establishments to develop procedures for informing customers upon request of major food allergens on the menu, and require restaurants, food establishments by January 1st, 2025 to post on their menus and menu boards a request for customers to notify their server before placing an order of any food allergies. And finally, it requires DPH by January 1st, 2024 to report to us, the Public Health Committee, on plans to implement that food allergy training requirement for certified food protection managers. Is there discussion on this item? Senator Summers.
Yes, I will not be supporting this today. If you look, we've just adopted the model food code that we've been trying to get in place for years. The Department of Public Health testified against this bill, and I don't think that we need this bill. I think it's duplicative, so I'm going to be voting no on this today. Thank you.
Thank you, Senator Summers. And Senator Summers is right in that, as I mentioned during my outline, we did have that go through regs review, which is an important step forward. I think this bill seeks to assure that we continue to move that process forward and that implementation is done in a robust way. But I appreciate your comments, Senator Summers. Are there other members with questions or comments? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar, Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes no.
Representative Clarice Beecher,
Representative Clarice Dietrich votes no.
Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Cabras DeGraw, Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Lenahan,
Linehan votes yes.
Representative Morrow, Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perello,
Perillo votes no.
Representative Perello, are you on video?
Yes, I am. Perillo votes no.
Thank you. Representative Rader,
Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan, Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wieelander,
Representative Wieelander votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Anwar, Senator Kushner, Senator Cabrera, Representative Elliott, Representative Foster, Representative Cabras DeGraw, Representative Morrow, Representative McCarthy, Senator Rahman, Representative Ryan, Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. Again, votes will be held open till 5. Item number 9 is next on our agenda. House Bill number 6298. This is an act concerning payment of civil penalties by nursing homes and residential care homes. This is a JF to the floor. May I have a motion? Moved by Representative Cook. Is there a second?
Second.
Seconded by Representative Kit. This item was a bill that we had just voted to propose to draft, and the JF is no different. It requires a nursing home or a residential care home that has a civil penalty to pay those penalties from monies that were set aside for administrative costs or expenses. Is there discussion on this item? Senator Summers, to be followed by Representative Kennedy.
Yes, I understand the intent of this bill, but I just don't see how it's going to be possible to enforce that. And these residential care homes are already under scrutiny and penalty. And I think that this is yet another bill that the title sounds great, but I don't know how accounting wise you would actually really be able to make sure somebody is taking it from one pot and not another. So I have reservations about this bill. If the industry obviously is against this bill, and I am going to vote no today to try to see if we can craft better language to really get to the end of what this bill is trying to do. The way it's written now, I don't know how you would be able to enforce what it's wanting to do. So I'm going to be voting no to flag this bill today. Thank you.
Thank you, Senator Summers. Duly noted, and we will be in further conversation on this one for certain. Representative Kennedy.
Thank you, Madam Chair. Essentially, Senator Summers said what I was going to say. While our seniors in our nursing homes deserve all the protection we can give them, I'm just concerned about how it will be enforced. Also, they're currently regulated federally, so my biggest concern is the enforcement. So for today, as we continue to look at the bill, I will be a no, but appreciate bringing this to the floor today. Thank you, Madam Chair.
Thank you, Representative Kennedy. Representative Cook.
Thank you, Madam Chairwoman. And I understand the concerns of the organizations, but I also understand the deep concerns of the residents of these facilities. And I recognize that there are complications on how we may be able to monitor or assess penalty. But time and time again, year after year after year, we see the residents in our facilities being put on the back burner. And when there are penalties, that comes out of the day-to-day funding mechanisms as opposed to somewhere else. And so if we penalize somebody for wrongdoing, it comes out of the day-to-day care. And I believe that that is unacceptable because the day-to-day care is not the person's fault. And so we need to ensure that the folks that are living in these facilities know that we do not want the money or penalties to come out of their care, but it needs to come out of the care of the people that are running those facilities or the owners of those facilities. We have seen time and time again, misuse, abuse, neglect. I also want to preface that by saying that we've had incredible caregivers. So I don't want to say that that is what we're talking about here. I think the folks that are on the ground doing the job in nursing homes do great work. But at the same time, when you have administrators or owners making hundreds upon hundreds of thousands of dollars, and the residents in those facilities are going without a shower in more than 3 or 4 weeks, or there's one staff for 30, 40, or 50 people, that is not acceptable. That is not humane, and we must do better. And if it is about going after the person that owns the facility or the person that's making the scheduling or the person that is excusing the behaviors, we need to figure out a way to do it. And I believe that this is a start, and I'm willing to work on making it better. If it means how do we pull the fines? But at the end of the day, we owe it to our residents in these facilities to ensure that they do not feel that their lives are in harm's way because of the neglect of somebody above them. And by no means, again, am I saying necessarily the nurses or the CNAs. That is not what we're talking about here. So I want to thank you all for raising this and continuously doing the good work for nursing home residents. Thank you.
Thank you, Representative Cook. And I would like to also thank Representative Garibay for her advocacy, also as one of our aging committee co-chairs on this. I think, again, we all agree we want to assure that our residents are safe, and we recognize that the pressures on the healthcare system have been pretty difficult, and the staffing pressures are impacting across the board, including in these facilities. But I appreciate your remarks and comments, Representative Cook. Representative Claridis Tetria, to be followed by Senator Summers.
Thank you, Madam Chair. I don't think anybody on this committee or in this room disagrees the fact that if a nursing home has done something wrong, that they should be fined and they should pay that fine and fix whatever the issue is. But in this bill, the issue is the funds will come out, not the issue, but the funds should come out of ownership funds or administrative funds, which I don't have a problem with, but how do we enforce it? There's nothing in this bill that states maybe if we could possibly add something, they have to report at the end of the year where the money's coming from and show some accounting trail with it. It could be a change that maybe I could possibly support, but we all agree that our nursing homes need to take care of the people that need the help the most, and that's our job as legislators. Thank you, Madam Chair.
Thank you, Representative. Senator Summers.
Yes, I just wanted to reiterate what Representative Claridis Tetria had stated. There's no one on this committee that doesn't want our nursing home patients to be put first. It's just the way this bill's written. There's no enforcement mechanism, and everybody can play accounting games as to where the money is coming from. So it's well intended, but the language needs to be, better defined, so to speak. And I will just say, while I respect Representative Cook's statement about some of our nursing homes, on the flip side, there are some amazing nursing homes and residential care homes that have done tremendous work throughout COVID and kept their residents safe. So we may have some that fall into sort of the category of neglect and misuse and not a place that we would want our loved ones to be. But there are many great nursing homes and residential care facilities. So I don't want people to think that this is everyone that we're talking about here. And I give those institutions great credit and all their staff that work there. It's a really tough job and they do really God's work. So I just wanted to make sure that was on the record. Thank you.
Thank you, Senator Summers. And I see Representative Cook nodding. I think we all agree that we're very fortunate to have systems of care that usually work really well. And when they don't, we need to make sure that we're doing what we can to stop that from happening. So I appreciate the conversation here today. And seeing and hearing no other comments, Madam Administrator, would you kindly call the roll?
Senator Anwar, Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes no.
Representative Titus Beecher,
Representative Clarice Dietrich votes no.
Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative Dauphiné, I did not see you on camera, please.
Rep. Dauphiné votes no.
Thank you. Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Capus DeGraw, Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes.
Representative Mara, Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perello,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan, Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wheelander,
Representative Wheelander votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Anwar, Senator Kushner, Senator Cabrera, Representative Elliott. Representative Cabras de Graaf. Representative Morrow. Representative McCarthy. Senator Rahman. Representative Ryan. Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. Votes open until 5 p.m. today. Moving on to item 10 on our agenda. This is House Bill number 6488, an act concerning cigarettes, tobacco products, electronic nicotine delivery systems, and vapor products. This is a JFS to the floor, LCO 6168. May I have a motion?
So moved.
Moved by Representative Kit. Is there a second? Seconded by Representative Steinberg. So the bill, as it is before us, has significantly changed. The S language will increase from $12 million to $22.7 million. The settlement fund disbursements to the Tobacco and Health Trust Fund. This $22.7 million is the minimum that the CDC recommends. That's where that number comes from. The bill also just requires that the Department of Mental Health and Addiction Services, the commissioner, in collaboration with Consumer Protection and Public Health, bless you, and Revenue Services, convene a working group to examine and evaluate the licensure fees, penalties, and taxes related to the distribution and sale of cigarettes, tobacco products, e-cigarettes, and vapor products. As we know, some of these policies have been effective in preventing and discontinuing use of some of these products to promote health. And with that, I will turn it over for comments, discussion on the item. Representative Kit.
Thank you, Madam Chair. I just want to say I am very glad to see that we are at least funding the minimum level of prevention and cessation programs as recommended by CDC. As somebody who sat around the table decades ago working on this settlement with various groups, this is how that money was meant to be spent. So I strongly support this bill. Thank you.
Thank you very much. Representative Zupkis.
Thank you, Madam Chair. I just have a question about the working group because it says, I think 3 or 4 commissioners, but then they'll appoint others. Who are those others?
Thank you for the question, Representative Zupkis. I think sometimes in our legislative language, we'll do a task force and we ask that our minority leader, majority leader, the speaker, the Senate president, each appoint someone. In this case, the working group design is meant to be a quicker turnaround so that they would use in their judgment some of the different stakeholders and be able to get people to the table a little bit more quickly. So it's not specified as to who exactly would be, but I certainly would expect and anticipate that if we are doing this working group, that we as legislative colleagues here would be having some input into what and how that group is comprised, though it wouldn't be as formalized as with the other process. And that's in part to help keep that process moving along so that we can get information back to us by January 1st of next year.
Thank you. I am interested to see who's going to be put on that. Every time these task force or working groups are put together, I always like to make sure they're fair. Number one, and number two, I also like to make sure everybody's represented, whether we agree with them or not. I think it's important to have all sides at the table because that's how we learn from each other and can work it out to be the best piece of legislation. So I hope that will be taken into consideration.
Thank you, Representative. And I agree. That's the goal. And I think in order to be able to craft good, solid policy, we want to have that. The one thing that is specified in this is that we do include, I think it's at least 2 representatives of at least 2 organizations that administer tobacco use cessation programs. And that's one of the things that we did specify because that's not always something that we're including in the conversation. Rep. Zupkis, please proceed.
Thank you. And I think that's great. And to my point, I think we should have the opposite view as well. just again, because I think it's very good to have people from all sides at the table. And I just don't want it to be one-sided.
Thank you. I concur. I can tell you that prior to being a member of this committee, when working on Tobacco 21, that was one of the things that I did with Senator Flexer, was to bring all parties to the table. So I think it's very valuable and important. Further comments or questions? Representative Foster.
I'll be brief. I'm just want to voice my support specifically for looking into both licensure fee and violation penalties. There's a lot of evidence around tobacco use and abuse and policies that have good evidence to support those looking to quit, and the ways that we prohibit access to those who should not be starting. And one of the things that is important is that the fees that are garnered through licensure programs are adequate to support enforcement efforts. And it's the view of the T21 best practices strategies that licensure fees that are $300 or below are likely inadequate to adequately police distribution of tobacco products to minors at these licensed venues. And since I think that's an agreed upon goal of everyone at the table, regardless of their support or opposition of previous versions of this bill in the past, I think the reality is we do not want to create a system where we tell folks they can't sell tobacco to minors and have no way of enforcing whether or not they're selling tobacco to minors. And so it's my hope that this group can assess what appropriate fines are for selling for minors, but also address what the appropriate licensing fees would need to be to support adequate enforcement. I think that that's something that most of us heard when this bill has had public hearings this year and in years past, that lots of places know who is selling tobacco to minors. And there is reporting, there is policing on these efforts, and they are under the current system. It takes 4 violations for there to be revocation of a licensure. And I think that this working group should consider whether or not we want you to be able to sell to minors and be caught doing it 4 times before we revoke your license, and making sure that the fines that are leveraged in the earlier violations of sales to minors are high enough to scare straight the folks that are selling to minors right now and make them change their adequate practices. And what I'll say is, someone who's spent a lot of time reading the research and talking to groups around these policies, I can't think of a good, credible reason why anyone would argue against fines for selling to minors or increasing licensing fees to make sure that we can enforce that folks who are doing who are selling tobacco products are making sure that they're selling them to the right people who should have access versus those who shouldn't. And so I support this provision because I think it's one of the biggest steps we've taken since T21 to create an evidence-based policy in Connecticut to prohibit access of tobacco products to minors. And I think it's a really good idea. Thank you.
Thank you so much, Representative Foster, for speaking to those incentives and disincentives, and also for your advocacy and work in bringing some of those diverse voices to the table around the conversation to help us get to those best solutions. Is there further discussion or comments on the item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar, Representative McCarthy-Vahey,
Representative McCarthy-Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Rep. DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jango,
Representative Jenga votes yes.
Representative Gilchrist, Representative Cabris DeGraw, Representative Kitt,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan.
Linehan votes yes.
I did not see you on camera, please.
Oh, I'm sorry, Madam. Linehan votes yes.
Thank you.
Thank you.
Representative Maurer, Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan, Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wieslander,
Representative Wieslander votes yes.
Representative Zupkis,
Representative Zupkus votes yes and hopes to see the changes in the working group. Thank you.
Senator Anwar, Senator Kushner, Senator Cabrera, Representative Elliott, Representative Gilchrist, Representative Cabris DeGraw, Representative Maurer, Representative McCarthy, Senator Rahman, Representative Ryan, Senator Slack. Thank you, Madam Chair.
Thank you kindly, Madam Administrator. Votes open till 5. I'll just keep reminding everyone that in case people weren't listening earlier. Moving on to item 12 on our agenda, this is House Bill number 6727, an act concerning the Department of Public Health's recommendations for implementing the recommendations of the Lead Poisoning Prevention Working Group. This is a JF to the floor. May I have a motion? Moved by Senator Summers, seconded by Representative Steinberg. Hang on one second, if you will. I want to thank this working group for the good work that they've done and these really important changes that they have brought to us. The bill will reduce from 72 to 24 hours the time frame within which a healthcare provider has to notify the parent or guardian of a child under 3 whose results indicate a level of at least 3.5 micrograms. It requires our 2 regional lead poisoning treatment centers to report quarterly to DPH and DPH to prepare materials on lead poisoning and prevention and a child's potential eligibility for birth to 3 program that existing law requires local health directors to distribute. It also requires the pediatric primary care providers to complete a number of items and prenatal health providers to provide certain guidance and screening as well. It also modifies the blood level thresholds at which the local health departments, lead poisoning prevention and control programs have to provide case management services. And before enrolling in public school, children will be required to have a lead poisoning medical risk assessment. This is something we've been talking about for a long time, and I think sometimes we forget how important these measures are, and I appreciate these changes that have been proposed. Is there discussion on the item? Representative Steinberg.
Thank you, Madam Chair. I want to note, as I did during the public hearing, the tremendous work of the working group for which I participated, I was more of a fly on the wall as they really got into the nitty gritty of their actual experience with, particularly with children. They did an excellent job of prescribing a pathway for us to try to deal with this problem. I think we'll go as far as the money that we're able to put towards a lot of the remediation that needs to take place. But this bill particularly focuses on good process and procedure for early identification and for trying to get to kids before this effectively ruins their lives. This is really important legislation. I also want to do a shout out to the former ranking of this committee, Dr. Bill Pettit, who felt very strongly about doing something about lead poisoning years ago. And I'm glad we finally reached the point where we're on that path. Thank you, Madam Chair.
Well, thank you to Dr. Pettit and to you, Representative Steinberg, and to everyone, again, who participated in this really critical work. Prevention, it really is key in this case. I believe Representative Palm.
Thank you, Madam Chair. I too want to thank Rep Pettit, former Rep Pettit, for this bill and for all the committee's work. I also think it's important to give a shout out to a former wonderful journalism outlet here in Connecticut, the Connecticut Health Investigation Team, which sadly no longer exists, but reporter Jennifer Frank did an amazing job exposing the dangers of this. And I know I spoke with Bill Pettit at the time, and that was a big part of why he got involved. So shout out to all the reporters who keep us on our toes.
Thank you for that. And isn't that true? It is a team effort. And I really, again, can't thank folks enough who are part of this. Representative Clara DeStitria.
Thank you, Madam Chair. I would also like to shout out to former Representative Pettit. That was a champion for this and the hard work he did and everybody else on the working group. So thank you to everybody. And with that, I'd like to move this item to the consent calendar.
Wonderful. That consent calendar that we had from earlier, that's wonderful. Seeing and hearing no objection, this item will be moved to consent. We will move on to item number 13 on our agenda. This is House Bill number 6728, an act concerning the Department of Public Health's recommendations regarding local health department food protection program audits. This is a JF to the floor. May I have a motion? Moved by Senator Summers. Is there a second?
Second.
Seconded by Representative Kitt. This bill is really what the title says it is. This will allow the DPH commissioner to conduct audits of the local health department's food protection programs. And that at a minimum interviews with the health department staff and joint inspections of local food establishments. The commissioner will provide those health directors with a report detailing the audit's findings. Is there discussion on this item? Representative Clara DeStitria.
Madam Chair, I'd like to put this item on the consent calendar.
Seeing and hearing no objections, this item, item number 13, will be moved to our consent calendar. Moving on to the next item on our agenda, item number 14. This is House Bill number 6729. An act concerning the Department of Mental Health and Addiction Services recommendations regarding the membership of various advisory boards and councils. This is a JFS to the floor, LCO 6183. May I have a motion? Moved by Senator Summers. Seconded by Representative Kitt. This item adds people with lived experience with the behavioral health disorders to the membership of both the Connecticut Valley Hospital Advisory Council and advisory boards for other state operated facilities. The bill also makes it mandatory that those other facilities establish advisory boards and really standardizes their membership requirements. Is there discussion on this item? Representative Clara DeStitria.
Madam Chair, I'd like to add this item to the consent calendar.
Seeing and hearing no objections, item number 14 will be added to our consent calendar. Moving on to item number 15, House Bill number 6730. An act concerning the Department of Public Health's recommendations regarding the Tobacco and Health Trust Fund and the requirement to check identification prior to selling cigarettes or tobacco products. This is a JFS to the floor and the LCO number is 6181. May I have a motion? Moved by Senator Summers. Is there a second? Seconded by Representative Kennedy. This bill does have some S language. Hang on for 1 second. Okay, so the S language actually replaces section 1 of the bill with section 4 of what is House Bill 6914, and that is the Attorney General's bill about the use of settlement funds. And this is really stylistic changes in order to be consistent in the two bills that are here before us as a committee. So minor changes in the S language. The bill itself, including that S language, it requires that funding be directed to evidence-based practices, and we heard that discussed earlier, the importance of that for various objectives, including state and community interventions, communication methods that we use, and the surveillance and evaluation. It does also require the board to give priority to comprehensive tobacco and nicotine control programs. It impacts the board vacancies and says that they also must be filled in the same manner as the original appointment. And finally, the bill does make a change to the ID requirement. In 2022, we changed it so that everyone who was purchasing tobacco at any age, the requirement was that they show an identification. And that was a change to an existing law that required identification for those who appear 30 or younger. Is there discussion on this item? Representative Reddington Hughes.
Thank you, Madam Chair. I would actually like to amend that to delete the brackets around the subsection D1 of section 2 of the bill. The amendment is subject to LCO technical and attorney changes. I think that this is not a good thing to do, the suggestion here, because it's basically turning this into shall to a may. And I believe that it is much better as far as what we have in place.
Now I have to turn my microphone on. Thank you, Representative. If you would just kindly repeat your amendment for all of us, which would be a friendly amendment, by the way.
Sure. To delete the brackets around subsection D1 of section 2 of the bill. And the amendment is subject to LCO technical and attorney changes, conforming changes.
Okay, I'm just going to confirm with our LCO, just in terms of line numbers in our S language. This is line numbers 133 to 136. Is that correct?
Yeah, that's correct. And also, since that's the only substantive change being made in section 2, you could also offer your amendment to just simply delete section 2 from the bill.
Thank you, Mr. Panzarella and Representative. I will turn the floor back to you to see if you want to alter that amendment or keep it as is.
I would take the suggestion of taking it off.
I think that's wonderful. I think it makes it a little clearer for all of us and for those following at home. So we have an amendment on the floor, which is to strike section 2 of the proposed substitute language in LCO number 6181. Is there a second for the amendment? Seconded, amendment made by Representative Reddington Hughes. The amendment is seconded by Representative Carpino. Is there discussion on the amendment? Representative D'Amico.
Yeah, Madam Chair, just for clarity, would you mind describing what the practical effect of deleting section 2 would be? Thank you.
Indeed, I actually will, I am happy to defer to the proponent of the amendment to answer the question. Madam Representative Reddington Hughes.
Sure. The original statute that was there, which would be to ask for identification of everyone who is buying the tobacco products, I think would be in better communion with what we're actually looking at doing. Because when somebody is coming to an establishment, we do not know their age. And I think that it's a much better situation to have this done with everyone. And, you know, rather than having people pick winners and losers.
Representative D'Amico?
So if I may, Madam Chair, just one more time for clarity. So in other words, if we do delete section 2, which is what the good representative is proposing, then we're going to go back to the system where everyone has to show identification regardless of age, whether they're a senior citizen or anybody else, they have to show identification in order to buy tobacco products. Is that what I should gather from all this?
Yes, that's correct, Representative. Representative Reddington Hughes, do you have any further comments?
No, for clarity, I just want everyone to be carded, whether they're 21 or they're 80, everybody will be treated the same.
Thank you, Representative Reddington Hughes. And was there further comment? I'm going to ask an LCO question. Is this available for a voice vote? Yes. Okay. So for those with no further comments or questions, we'll have a voice vote on this amendment. All those in favor, please signify by saying aye.
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 Okay, the amendment passes. So we're back to the bill as amended. Is there further discussion on this item? Representative Claritas Tetria.
I'd like to put this item on the consent calendar.
Thank you, Representative. So item number 15, which is House Bill 6730 as amended, will be added to our consent calendar. Next on our agenda is item number 16, House Bill number 6731. This is an act concerning the Department of Public Health's recommendations regarding change in ownership of healthcare facilities. This is a JF to the floor. May I have a motion? Moved by Representative Steinberg. Is there a second?
Second.
Seconded by Representative Kit. This bill, I'm going to preface my remarks by saying this is another bill that will continue to be discussed after leaving here. The bill basically expands the circumstances under which a licensed healthcare facility ownership changes are subject to prior approval by DPH. It eliminates certain exemptions in current law, and it requires the proposed owners to submit several documents and information. As under current law, it also requires DPH to inspect facilities and set standards under which DPH may deny an application. We've heard from a number of folks about some of their questions and concerns on this and have promised that we will continue to engage in conversation. We've been in touch with the Department of Public Health and some of those stakeholders regarding those concerns, and the conversations are actually already beginning. But we are going to keep this bill moving forward, again, expecting changes and amendments that would occur on the floor. Is there discussion on this item? Senator Summers.
Yes, I am going to be voting no on this bill today. If you look at the testimony from the industry, this is creating another level of burden for them. You're going to have to reporting now. If there's any change in ownership, the ownership could be 0.5%, and that requires fingerprinting, background checks, etc. It also is requiring the owners to supply copies of leases to the state of Connecticut, which is, and many times containing confidential information. So I think this bill needs a lot of work, and I'm going to be voting no today to flag it to help try to get to where they want to be moving forward. Thank you.
Thank you, Senator Summers. Representative Cook.
Thank you, Madam Chairman. And I understand the good senator's concerns, but I, in fact, will be supporting this piece of legislation. I think part of the issue that we've had over the years is a lot of pieces of ownership for certain facilities have been tucked away or hidden. And tracking the dollars has been very difficult when we're trying to hold folks accountable. There are names, there are LLCs, there are private pieces of property. And so for me, I think that the most transparency that we can give these facilities, and again, this is not all facilities or not all owners, But I do believe that we must in fact make sure that we know where all the dollars are going. When we talk about full transparency in every conversation in this building, this just adds to the full transparency. And I also think that it's extremely important that as we look at certain owners of certain facilities trying to consistently buy up properties or buy up different facilities, that this also in fact helps the department make sure of who's taking ownership and what that might look like. So I absolutely believe this is vitally important and I am happy to support it today. Thank you all.
Thank you, Representative Cook. Other comments or questions on this item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar, Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Rep. Burger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster, Representative Jengo,
Representative Jenga votes yes.
Representative Gilchrist, Representative Cabris DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Representative Linehan votes yes.
Representative Morrow, Representative McCarthy,
Representative McCarthy votes no.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wieelander votes yes.
Representative Zupkis,
Zupkus votes no.
Senator Anwar, Senator Kushner, Senator Cabrera, Representative Elliott, Representative Foster, Representative Gilchrist, Representative Morrow, Senator Rahman, Senator Slack. Thank you, Madam Chair.
Thank you, Madam Administrator. Votes will be open till 5. Next on our agenda. Moving on to item number 17, House Bill number 6741, an act improving the safety of healthcare providers and patients. This is a JFS to the floor, LCO 6164. May I have a motion? Moved by Senator Summers. Is there a second? Seconded by Representative Clarice Detrier. The S language that we have before us changes the language to include all areas of the hospital and not just the entrance of the hospital. I'd like to thank Senator Martin for his advocacy and the nurses who came before us. This bill would require DPH to develop a marketing campaign and to make monthly service announcements about the mistreatment of our healthcare providers. We talked a lot about encouraging civility in public settings. This bill also addresses the dealing with violence and the aggression that's occurring, not just the incivility. It establishes a hospital security grant program to be administered by OPM, and it authorizes hospitals to establish policies and procedures regarding if and when a patient would be able to be removed related to their conduct. Is there discussion on this item? Seeing and hearing none, Representative Clara DeStitria.
Madam Chair, I'd like to put this item on the consent calendar, please.
With no objection, this item will be moved to our consent number, our consent calendar. That is item number 17, House Bill 6741. Move to consent. Next on our agenda is item number 18. That's House Bill number 6819, an act concerning lactation consultants. This is a proposed JFS to the floor. This is LCO number 6167. May I have a motion? Moved by Senator Summers. Is there a second? Seconded by Representative Clara DeStitria. This bill requires DPH to obtain a list from the International Board of Lactation Consultant Examiners, those Connecticut residents who are on the board's registry, and it also creates a task force to study lactation consultant licensure, including the qualifications and whether the state should license or certify counselors certified by the Academy of Lactation Policy and Practice. I will say that for all the lactation consultants who are listening out there, this is the beginning of a conversation that we hope to be inclusive and listening to the concerns and needs of those who are practicing at multiple different levels, with the goal of being able to provide more lactation support to women of all backgrounds, of all ages, races, and economic demographics. And that's our hope with this. Is there discussion on this item? Seeing and hearing none, Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to put this item on the consent calendar.
Seeing and hearing no objection, item number 18, House Bill 6819 will be moved to our consent calendar. Moving on to item number 19 on our agenda, that's House Bill number 6837, an act concerning the license renewal fee and schedule for licensed clinical social workers and licensed master social workers and the examination requirement for licensure of master social workers. This is a JF to the floor. May I have a motion? Moved by Representative Cook. Is there a second? Seconded by Representative Welander. This bill is a JF. We will be continuing the conversation on this. As you may recall, the Department of Public Health and this bill have some conflicting provisions in it related to the test that is for social workers, required for social workers. We've also heard testimony from some other providers in terms of the fee schedule piece, but the bill itself will allow DPH to wait until through April 1st, 2026 to waive the examination requirements for a master social work license if the applicant has a master's degree from an accredited social work program. And in addition, in terms of the fees, it reduces from $195 to $100 the license renewal fee for the clinical and master social work programs, and requires the social workers renew their licenses every 2 years instead of annually. Is there discussion on this item? Oh, Representative Kennedy.
Thank you, Madam Chair. I certainly recognize that we have a shortage of social workers and what their role is, that they are so very important and vital in so many situations. But today, there are portions of the bill I have some concerns on, and I know you just mentioned some of them, but moving forward, until we've had input from all parties that would be impacted by this, I will be a no. It seems to me that the purpose of the exam is to make sure that a social worker is qualified to begin their clinical work. So I'm not sure extending the testing date out to April is the right solution. So I look forward to having many more discussions on this bill to really strengthen it and to make sure that we get people in these positions because, as I said, the work of a social worker is so very, very important. So thank you, Madam Chair.
Thank you, Representative Kennedy. Yes, social workers are our largest, most diverse group of mental health providers in our state. And so we appreciate the work that they and all of our providers do to help us be healthy, safe, and strong. Other comments or discussion on this item? Representative Renington Hughes.
Oh, thank you, Madam Chair. Well, I absolutely understand that we need more social workers and they are one of the most valuable in the system. I've sat here and listened to many people suggest that they enter other fields within schools and everything else that are just compounding what they're already doing and what is on their plates, to not have any metric to measure whether or not somebody is ready to go into that line of work, I think is really not thinking ahead. So we're actually trying to put more on their plate and then having no metric to see whether or not they're prepared for that by extending, the absence of an exam. I'm very worried about that. Thank you.
Thank you. And I appreciate that conversation. I think that's why this bill, as opposed to removing the date and removing the exam entirely, does have a set time period. And we did hear some really interesting conversation related to that. I think the social work body is probably one of the first who has actually examined some of those inherent biases and tried to take a proactive look at what to do about it. So it's a bit of a conundrum, I think. But I respect and appreciate your comments. Further comments or questions from members of the committee? Senator Summers.
Yes, well, I understand the intent of this bill. I am going to, again, vote no to flag this bill because I think it needs much more work. We've heard from other folks that are not just social workers that would like the same kind of treatment that we're giving social workers here. So I think this is starting to expand the ask, so to speak, and I'm not sure how we choose one specialty and not another to do what we're doing here for social workers. So I'm looking forward to working on this going forward, but I will be voting no to flag this bill today. Thank you.
Thank you, Senator Summers. Representative Kennedy. Excuse me, McCarty. I'm looking at you and I'm saying Representative McCarty, please proceed.
Thank you very much, Madam Chair. And I would just like to make a comment that I think it's important that we do keep as many of the social workers that we can. We have a tremendous shortage throughout the state. My question deals with, do we know who would be involved in looking at the examination to ascertain whether the examination is appropriate, or will that be worked on going forward? But just an idea of who actually would be studying the examination.
Well, the bill does not specifically address that, but this is the national body. So it's the national body who has recognized the struggles with the passage rate, particularly across different racial. And I think that's really the main issue that has been identified. So my presumption is that the national body would. I think we, as a legislature, will continue to have these conversations, just because if we're making the decision about whether we remove that requirement for the test or entirely or go to a date certain, either way, we're going to want to continue to have conversations with representatives of that body. But in the end, they are going to be the ones who will make the determination about what that test has within it.
Great. Thank you.
Thank you, Representative McCarty. So my apologies to the good representative. Are there any other questions, concerns, comments, or points of discussion? If not, Madam Administrator, would you kindly call the roll?
Madam Chair, I think Representative Perrello would like to say something. His hand is raised.
Oh, I am so sorry, Representative Perillo. I had a different screen on and did not see your hand raised. Please proceed, Representative.
No worries, Madam Chair. I appreciate it. And Madam Administrator, thank you for seeing me. I just want to thank Senator Summers for her remarks. A lot of us have been in this building long enough to know that sometimes if you hire a lobbyist and you yell the loudest, that you get recognized. And I think in this particular case, that has happened. And there are a lot of professionals who are not represented in this bill. And I hope we'll consider representing them down the road. Licensed marriage and family therapists, they're working just as hard. Oftentimes they're seeing the same types of clients, oftentimes right next to a licensed master's level social worker who this bill rewards and doesn't recognize the marriage and family therapist. So as this evolves through the process, I would just hope that leadership would consider that.
Thank you, Representative Perillo, and I will also thank Madam Administrator for your help and assistance in assuring that Representative Perillo was able to be heard. And yes, indeed, as I noted in my opening comments, we did hear from the licensed marriage and family therapist. I don't know, it's certainly, we all hear from different folks. I've heard from those LMFTs as well. Again, I think we will have to take a more comprehensive look at this and see what we can do to assure that we are allowing for and supporting the majority, or allowing for and supporting as many of those providers as we can, especially in the face of what we know is an ongoing mental health crisis, not just for children, but also for adults, parents and adults, which we don't often talk about out loud. So I thank you for your remarks, Representative. Are there further comments, other discussion on this item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes no.
Representative Clara DeStitria,
Representative Claire DeStitria votes no.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Rep. Burger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes no.
Representative Cook, Representative Dauphiné,
Representative Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Representative Gilchrist, Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no to flag.
Representative Linehan,
Linehan votes yes.
Representative Morrow, Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wieelander votes yes.
Representative Zupkis,
Representative Zupkus votes no.
Senator Kushner, Senator Cabrera, Representative Gilchrist, Representative Morrow, Representative Rader, Senator Slack. Thank you, Madam Chair.
Madam Administrator, Representative Rader.
Yes, I just want to make sure you got my vote because I thought you repeated my name just now.
How would you like to vote, please? I didn't hear you.
Representative Rader votes yes.
Thank you.
Thank you, Madam Administrator. Okay. Back up to page 1. We're getting there. We're doing a great job. I want to thank everyone for sticking with us on this ambitious agenda. I appreciate it. Okay. Moving on, we are going to go to item 4, Senate Bill number 1065. An act concerning the Department of Developmental Services recommendations regarding various technical revisions to the developmental services statutes. This is a JF to the floor. Is there a motion?
So
Moved by Senator Summers, seconded by Representative Kit. The item that we have before us. Hang on one second. This one updates ombudsman with ombudsperson in various sections of the bill. It removes outdated references to the DDS daycare program. And it conforms to existing practice by reflecting certain types of residential programs are certified rather than licensed by DDS. Is there discussion on this item? Seeing and hearing no discussion, Representative Clara DeStitria.
Madam Chair, I'd like to put this item on consent.
Seeing and hearing no objection, item number 4, Senate Bill number 1065 will go on the consent calendar. Next item on the agenda is Senate Bill number 1066, an act concerning the Department of Public Health's recommendations regarding food inspectors. This is a JF to the floor. May I have a motion? Moved by Senator Summers and seconded by Representative Clara DeStitria. This bill, it changes the DPH, Department of Public Health certification requirements for food inspectors. It eliminates the requirement that applicants be employed by a municipal or health district before receiving their certification. So it allows them to complete their certification requirement prior to working as a food inspector. And it specifies that the commissioner must prescribe the required training and verification program that applicants must consider. In addition, it deals with conflicts of interest essentially. So food inspectors, where there's a situation where there's an immediate family member and there's a business association, it provides some additional prohibitions, including having any financial ownership or interest in the food establishment located in the district where the food inspector would be working. And engaging in any business or management of an establishment in that jurisdiction, or owning the property where the food establishment is located. And finally, it requires health directors employing food inspectors to certify that the food inspector is not prohibited from working as a food inspector based on all of those conditions. Is there discussion on this item? Seeing and hearing no discussion, Representative Clara DeStitria.
Madam Chair, I'd like to add this item to the consent calendar.
Seeing and hearing no objection, item number 5, Senate Bill 1066 will be added to our consent calendar. Next on the agenda is Senate Bill number 1068, an act concerning the Department of Public Health's recommendations regarding a human immunodeficiency virus, pre-exposure prophylaxis, and post-exposure prophylaxis drug assistance program. This is a JFS to the floor, LCO 6180. May I have a motion? Moved by Senator Summers and seconded by Representative Claritas Deetria. This bill changes the DPH program from not just a post-exposure to a pre-exposure, and it provides the pre-exposure and post-exposure prophylaxis, otherwise known in what we've called here PrEP or PEP, as long as there is $25,000 of aid service funding for this. It is a requirement, which is a change in the S language, I will note. The program provides financial assistance to people at risk of acquiring HIV to help pay for the medications, and it's targeted to people who are underinsured. And again, it gives priority to people at increased risk of acquiring HIV. Is there discussion on this item? No? Oh, I'm sorry. Representative DiCaprio.
Thank you, Madam Chair. Do we, just a question, do we know if there's an age requirement on this bill?
Representative, give me a moment. I don't believe so, but I just need to double check my notes. And
Well, with that, is there parental consent?
no, there is not.
Thank you.
Thank you. No, this is designed as prevention, so there is no age and no parental consent on this bill. Is there further discussion on this item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Representative McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Claritas Deetria,
Representative Claritas Deetria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Burger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes
Cook?
yes.
Representative Carpino,
Representative Carpino votes yes. Thank you, ma'am.
thank you. Representative Cook, Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Dunning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Rep Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Gilchrist, Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lenahan,
Linehan votes yes.
Representative Morrow, Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slatt votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis, Senator Cabrera, Representative Cook, Representative Elliott, Representative Gilchrist,
I'm so sorry, Madam Clerk, what bill are we on?
Senate Bill 1066. Item number 5 on the agenda.
Representative Gilchrist votes yes. Thank you.
No, Madam
I'm
Administrator,
sorry,
forgive
it's
me.
item number 6.
Madam Administrator, I believe we're on 1068.
1068, I'm sorry.
Thank you.
Okay, hold on. I'm so
Thank
sorry.
Item 6 on the agenda.
Okay. Representative Gilchrist votes yes. Thank you.
Representative Mara, Senator Rahman. Thank you, Madam Chair.
Thank you, Madam Administrator. Okay, give me 1 second, folks, if you would. Okay. Senator Anwar, are you prepared to proceed?
Sure. Thank you, Madam Co-Chair.
Okay. Item number 3, Senate Bill number 1016, an act concerning truth in advertising by healthcare providers, the JFS to the floor, LCO 6190. Is there a motion?
So move.
Moved by Senator Anwar. Is there a second? Is there a second? I think I heard someone out there. I'm not sure who that was.
Second.
Seconded by Representative Kipp. Senator Anwar, I'm going to turn it over to you.
Thank you, Madam Co-Chair. I hope you guys can hear me. Can you hear me?
Yes.
Okay, good. So this bill has 3 broad areas. One of the areas that we have in this bill is protecting the title of nurses. This was a bill that I had proposed about before the pandemic at the request of the Connecticut Nurses Association. And this bill is about, came from the Connecticut Nurses Association, where they feel that at times the title of nurse is being used by various individuals in the healthcare field. And they felt it's important to have a protection for that. So this bill actually brings that protection to make sure that the nurses who have gone through their training and their experience and their work, they are recognized and they are sometimes what happens is knowingly or unknowingly people start to call individuals in the healthcare field who are nurses assistants or PCAs as nurses. And it's important to have that identification because it reduces the value. And at times when people are providing some of the jobs, they may actually use that to give a job to somebody else and suggest that that individual is a nurse. So that's one part of that bill. The second part of the bill, which I think when you look at the testimonies, was not well recognized by individuals, is about making sure that everybody who actually has their existing titles, they are not going to be touched. For example, the naturopaths, their title is not touched. The podiatrists, their title is untouched. In other words, everybody who has their existing titles in the not going to be impacted in any shape or form. So that's part of the bill as well, that existing statutes do not impact the APRN's title. It does not impact the CRNA title. It does not impact the title of physician. It does not impact the title of the naturopaths and the podiatrists and the ophthalmologists and optometrists. So that's important for us to keep that in mind. The third part of the bill is looking at the specialty areas in healthcare and medicine. For example, cardiology, endocrinology, anesthesiology, rheumatology. Those titles are to be protected because the existing protections have not been able to address that, as some individuals at times on the healthcare field try to use those titles directly, indirectly in some of those areas. And that's the purpose of the bill, is to make sure that the individuals who are in the expertise of an area, like a cancer specialist. So can you imagine your loved one going to somebody who claims to be a cancer specialist and is not? And then those patterns have started to evolve in parts of our country and in Connecticut as well, more so in the dermatology arena and also in psychiatry arena as well. And that's where things are moving in the wrong direction. It's important for the protection of the public. It's important for the knowledge for people to be aware of that these should not be allowed. And that's what is the third part of this bill. So I will stop here and we can try to answer any questions. Thank you, Madam Co-Chair.
Thank you. Is there discussion on the item? Oh my gosh, I keep calling you representative. Senator Kushner.
It's because you like me so much. You want me to be in the House with you. I am going to be voting yes on this bill, but I do want to note that I have concerns about it. And I hope that if it moves forward, we'll have an opportunity to discuss it, make sure that we're addressing the problem at hand. So I just wanted to note that for the record. Thank you.
Thank you, Senator Kushner. Is there further discussion on this item? Senator Summers.
Yes, I believe that this bill started out with good intentions, but the way it's written to me is a complete overreach of where we need to be. Right now, we're going to be telling private physicians what they have to wear, how they have to identify themselves in their own offices. And, many of the physicians that I know personally, they don't wear scrubs. They're certainly not dressed up like Senator Anwar is right now. They're in their office, meeting their patients in a casual outfit. They don't want to have to wear a name tag and identify themselves in their own office. This also, I think, puts nurses and other APRNs at a big disadvantage. I don't agree with the way this has been, framed by Senator Anwar. So I'm going to be voting no on this bill today. Thank you.
Madam Co-Chair, can I just clarify something?
Yes, go ahead, Senator Anwar, and then and I'm actually Senator Anwar, and then
For
followed by
benefit of
Representative Clara DeStitria.
Perfect. I just want to make sure for everybody else's benefit, the Connecticut State Medical Society, Connecticut OBGYN, literally every specialty society in the state of Connecticut, from medical perspective, the physician groups, they are in support of this. So these are the organized groups, and the membership have made this call and request to support this bill. So I just don't want people to get the impression that all of the people are reaching out to one of our colleagues to say that they are not interested, but the official statements are there in the testimonies. Thank you, Madam Co-Chair.
Thank you, Senator Anwar. Back to you, Senator Summers.
Yes, just to put it in perspective, the Med Society, less than 1% of practicing doctors in the state of Connecticut belong to the Medical Society. So you may have the Medical Society pushing this as an agenda, but many of the specialty physicians that are not affiliated with the Med Society, because again, less than 1% of our physicians belong to that society, do not necessarily like the way this bill is written and requiring them to do things they're not comfortable with. There's also great pushback from the nurses, nurse anesthetists, some APRNs, your chiropractors, your naturopaths. So outside of the Med Society and the specialties that are represented through the lobbyists here in the legislature, there are many clinicians that don't agree with this. And so therefore, I just feel if you read through it, it goes really far in telling people what they have to wear, how they have to identify themselves. And I think it's overreach. So I will be voting no on this bill today.
Thank you, Senator Summers. I missed Senator Marks online, then Rep. Clara DeStitria, to be followed by Rep. Linehan.
Thank you, Chair, through you. I will be voting no on this bill. I've been listening to it in its development. I will tell you, as a nurse, I do not belong to the Connecticut Nurses Association, and I probably never will. Very few of the nurses that I know are part of the CNA. I don't care if I'm called a nurse, an LPN, or an aide, honestly. All I care about is the outcome of my patients and that I can be the best nurse possible. Just like I really don't care if you all call me senator all the time either. My value is not based on what I'm called. My value of a nurse is based on my job performance. As far as the other cardiology, anesthesiology, anesthetist, you know, the ologist just means that you are expert or you have knowledge in a certain aspect of science. I guess you could call me a nurseologist. I don't know. But there are, you know, we have so many APRNs that are so specialized in so many different aspects of their practice. And now on my congestive heart patients, that they are, after they get discharged after a week or two, they actually have a very comprehensive visit with an APRN who just specializes in congestive heart failure, which the teaching and the medications are so unique to that one disease process. And I am just thrilled that they actually get to go and have care by a nurse. I guess I could call her a cardiologist. I just call her the CHF APRN, the congestive heart failure APRN. And she is going to sit and be able to spend 45 minutes to an hour with that client, which is what I am doing as well in the home for teaching for a great outcome. All we care about is outcomes. All the nurses that I know and love and cherish, I've never had a patient tell me that they felt they got care by a dermatologist when it was not a dermatologist. So I have not heard any concrete evidence that there is actually a problem out there in our community. We have so much going on right now in our healthcare industry that I don't think we need this. When I go to a physician in their office, I don't want them to have to wear a badge because of something I passed. So I am just saying it was not with ease that I decided to vote against this. I mean, it is ease of my heart. I have so much respect for Senator Anwar, and I think the meaning was good. I just don't see the need. And so I will be voting no against this. Thank you.
Thank you, Senator Marks. Representative Clara DeStitria to be followed by Representative Linehan.
Thank you, Madam Chair. The intent of this bill, I don't believe we truly hit it on with this language. I'll be a no today. It's duplicative. If you're in a hospital, if there's an issue, your hospital should be taking care of it. Someone can report if someone's doing something illegal or misrepresenting themselves. So I will be a no here today. I just don't think this bill is necessary. We have many more important issues to be addressing besides this bill here. Thank you, Madam Chair.
Thank you, Representative Clara DeStitria. Representative Linehan.
Thank you very much, Madam Co-Chair. You know, this one is a real difficult one for me. And I'm not even sure if it affects it's the stated intent of the bill is the same thing as what's actually in the language. For me, it looks like it's coming down to whether or not, let's use, for example, a nurse anesthetist can be called a nurse anesthesiologist, right? But when we're talking about the truth in advertising for healthcare, if I put 100 people in a room with no background in medicine, they're not going to be able to tell you the difference either. So to be able to put that on a badge, for me, I'm not sure it gets to the intent of really educating the public. That's my concern. You know, originally when we began discussing this bill, I really believed that it was going to be about the fact that chiropractors they don't hold an MD, or that naturopaths, they don't have prescriptive authority in the state of Connecticut. That kind of thing is really important to me, and I think to my constituents. But when I look at this, I just don't see where putting anything on a badge between anesthetist and anesthesiologist is going to make a difference. However, I do believe that having a badge that says who you are, what you're doing, and why you're there is really important, even if they don't understand that small nuance. So this bill kind of, it's good on one end and not so good on the other. And I had said on an earlier bill that I don't want perfect to be the enemy of the good here. We have spent many years going over bills that were in the past, like our pregnancy centers bill, where we had people in white coats talking to women about pregnancy. So I would like the idea of the tag to explain that even if they are wearing the white coats, that they're not actually doctors. I don't think that it would be a problem for a doctor who is wearing a dress or a golf shirt to clip that badge somewhere else. I don't see a problem in the badge section of this bill. Where my concern is the ologist versus non-ologist. So, but again, I don't want perfect to be the enemy of the good. So I am going to vote for this bill today, but I am going to reserve my right to vote against it on the floor if these challenges aren't overcome in the final language of the bill. Thank you very much, Madam Chair.
Thank you, Representative Linehan. Senator Summers.
Yes, for those that are thinking about supporting this, I just wanted to let you know, we do have an OLR report, which shows that clearly right now, all of the things that you're worried about in this bill are covered under existing law. So I'm not sure why we're duplicating this. I know I had shared it with Representative Denning. It goes through section by section and calls out where in our statutes these issues are already covered. And this is, again, another layer of bureaucracy on something that is already covered on our existing statutes. So I'm happy to share that with everybody if it hasn't been shared. And I, again, feel that this is an overreach of telling physicians how they have to identify themselves in their own private practices. We passed a law in 2012 in this body that requires if you're in the hospital, you have to have a badge, you have to wear it. It says, I'm sure Representative Steinberg remembers this, of what your specialty is and what it would say, for example, you know, Jonathan Steinberg, MD, FACS. It would not say Jonathan Steinberg, anything like that if he wasn't a doctor. So it's already identified. So we have that in the hospital. This again is an overreach. There's a lot of pushback from our nurses, our nurse anesthetists, our APRNs, and I just don't see the need if we already have statute covering this. So that's the last that I will talk about this, I promise.
That's okay, Senator Summers. My mom always taught me never say never. So Representative Foster to be followed by Representative Denning.
Thank you, Madam Chair. I think I'd like to, I agree with a lot of the concerns that have been spoken so far, but I'd like to share an opinion that I don't think has been spoken about this bill so far. The title is jarring to healthcare professionals who feel like this bill is targeting. I have spent a lot of time in the last 2.5 years talking to a broad array of healthcare providers about their concerns of folks who are practicing outside of their scope and ability and providing and prescribing and recommending medical procedures not rooted in science and data. And when I read the title of this bill, I thought it was an earnest attempt to address pseudoscience, bunk science, sometimes called woo-woo science, remedies that are being prescribed writ large for certain conditions that is not necessarily an effective treatment for. And I think that there are certain populations that are disproportionately targeted by deceitful practices in the healthcare or healthcare adjacent arena. And Representative Linehan shared the crisis pregnancy center bill that we had a public hearing on. But if you have a child on the autism spectrum, there are folks who will reach out and recommend all sorts of different things with all sorts of varying credentials with very limited, perhaps concerning efficacy. if you have a diagnosis of lead poisoning or toxicity, there are folks with pseudo credentials or poor credentials who will recommend home heavy metal chelation therapies, which are ill-advised. There are a wide variety of deceptive practices that fall under lack of truth in healthcare or healthcare adjacent spaces. And I wholeheartedly believe that we as the legislature should prioritize addressing that. People are being harmfully treated and could have deleterious outcomes because of lack of honesty and truthfulness in their practices. What I don't think is the problem with the lack of truth in the healthcare space is that healthcare providers like PAs and APRNs, who I swear in 6 hours, every hospital would stop running if they stopped working, are part of the lack of truthful and honest practicing in the hospital and healthcare-based setting. And what I was particularly persuaded on is that these providers listened in and tuned into this public hearing and felt like they were being targeted as a way to sort of put and separate their space in the healthcare system different from others. And after we're coming out of the COVID pandemic, these providers were the reason why things kept going in incredible medical shortages. Every healthcare provider in the healthcare system is crucial, but for the vast majority of times on the vast majority of hospital floors, PAs and APRNs keep the system moving in a way that is incredibly essential. And we couldn't function in our healthcare system without it. The number of PAs and APRNs who reached out to me on this bill, which seems to be my entire neighborhood, gave me pause. And that they're not the only specialty who reached out with this concern. And I think there are a lot of provider types who feel like this will have unintended consequences. I'm the first person who will say that we need to make sure people understand the credentials and the scope of practice of the people providing care for them. But I don't know that the terminology, the difference between physician and doctor, is the thing that we need to make sure patients know and understand. And I think even with clarity in that, people are confused about what the scope of practice and training for their healthcare providers are. And I don't know that that is the biggest glaring problem before us in the medical system today. And so I will just say that today I'm a no on this bill, and I hope that we can find a way to address things that are lack of truth and deception in the healthcare space, people who are practicing outside of their scope and provide a danger to their professionals. But I am not convinced we do not already have those tools available. And I hope that if there are folks who fall into that category, we can adequately address those concerns and that lack of safety. But at this moment in time, I am a no today.
Thank you, Representative Foster. Representative Denning, to be followed by Representative Cavros DeGraw.
Thank you, Madam Chair. As the only nurse anesthetist who would be affected by this as a profession, because numbers in section 2 of all the titles 1 through 38, there's only one profession that uses ologist in their title at all, and that's anesthesiologist with a nurse in front of it. It has not been a problem. I would propose an amendment to strike section 2 from the bill.
Representative Denning, if you actually, I'm just going to ask us to pause for just a moment. If we can just do that. Give me a moment. Okay, thanks, everyone. We're back. Okay, Representative Denning, you have an amendment. If you could describe.
Madam Co-Chair,
Oh, yes, Senator Anwar?
Madam Co-Chair, I'll take that as a friendly amendment, if it's okay with the person who seconded it.
Okay. Representative Denning, could you repeat your amendment for the benefit of the members of the committee? Oh, please use your microphone.
Thank you. Madam Chair, thank you. I propose we strike section 2 of the proposed bill and carry on with the rest of the amendment or the bill that allows for the protection of nurses and the badging that is required in hospital settings to identify people who are there.
Okay, there is an amendment on the table made by Representative Denning to strike section 2 of the bill. And I'm going to
Second
turn
it.
to our LCO. I'm pausing for a moment on the second. I believe I just need to consult with our LCO attorneys for a moment. So again, just please hold. Thank you so much for your patience, everyone. You know how we often talk about how wonderful our LCO attorneys are and our OLR attorneys are and what a team effort this is. So Representative Denning, I believe in order to honor the intent of what you are asking to do, I believe what you are looking for is an amendment in section 2, subsection C, 2C. And that is lines number 54 through 77. Is that correct? And Representative Denning, can you help me be sure I am understanding that? Because
Actually, I want to strike from section 19, line 19. Excuse me, this is my first time. To line 77.
So that is also including the portion that is about the badges as well. That's what your amendment is?
That is going to be my amendment, yes. But since we already have badges already on the law, they're required. There's no reason to replicate them. So we can strike out the entire section and it should make it very clean.
Okay. So there's an amendment. Oh, there's an amendment being made by Representative Denning to strike section 2 of the bill, which is line 19 through line 77. Am I correct, Representative Denning?
Yes, Madam Chair.
Okay. We will take discussion after a second. Is there a second on this amendment?
I will second that.
Second.
Okay, seconded by Senator Summers. For discussion purposes, Senator Anwar.
Thank you, Madam Chair. Madam Chair, can I ask a question of the proponent of the amendment? What is the purpose of the amendment, please?
The purpose of the amendment is to allow certified registered nurse anesthesiologists to use that title in this state without becoming a felon.
So can I clarify? Because initially when you were speaking, you just wanted that title to be removed, but now you're removing a larger part of the bill.
Yes, I am, because I recognize that it may cause risks for other professions that come after us. And why put a restrictive bill on healthcare providers who may be coming after us, who want to increase their professional level and practice under the title of nurse, oncologist, nurse, cardiologist, or whatever particular nursing profession they decide.
So, so your perspective is that in future you would want the nurses to be called cardiologists and oncologists. Is that what your testimony, or not testimony, but your position is?
Only with the title nurse in front of their name, Mr. Chair.
But through you, Madam Chair, I don't see that nurse added to the testimony, so I'm not sure, not the testimony, but your amendment. So you're saying that by removing that amendment, you are trying to make sure that in future nurses or any other profession can use the term cardiologist and oncologist and dermatologist. Is that the intent?
The intent of this bill is to prevent nurse anesthesiologists from being restricted from using a title from which they can currently use in other states, so that they will want to come and practice here in Connecticut. My purpose of not just striking anesthesiologist is that in healthcare today, and I think you would agree, we are in a transformation of providers and healthcare access, and that the nursing profession is expanding, as well as physicians, as well as physical therapists, as well as a host of other providers. And as this bill worked to restrict my profession, I would like to see that we remove that restriction from future restrictions in all possible nursing professions, even those that do not exist today.
Okay, now I understand it. Madam Chair, I would just urge everybody not to vote for this amendment. Actually, the proponent of the amendment has already said the intention of what the bigger goal is. And just make sure, if you have ever gone to somebody with specialty care, what that would mean going forward. So I just wanted you to be aware. Thank you so much, Madam Chair.
Thank you, Senator Anwar. Representative Berger Giavalo, followed by Representative Linehan, on the amendment only, please.
I'm actually going to take my hand down until we're done with the amendment. Apologies, I was trying to remove it and it seems to be stuck.
Thank you very much, Representative. We will come back to you for discussion on the bill. I will go to Representative Linehan to then be followed by Representative Wielander.
Thank you very much, Madam Chair. And I just have a few questions through you to the proponent of the amendment.
Thank you, Madam. Please proceed. Representative Denning, actually, please prepare yourself.
Thank you very much, Madam Co-Chair. I guess my question is, if we were to eliminate lines 19 through 77, what's left in the bill? What would the bill now do?
I believe, Representative, that nurses are now protected from people who are not nurses calling themselves nurses. And I would have to add to the amendment that it was subject to LCO language.
Madam Co-Chair, may I continue? Thank you very much. Okay, so this now becomes a bill that only protects the title of nurse and doesn't in fact concern anything regarding truth in advertising by healthcare providers. Is that correct through you?
I don't believe that this bill protected anybody with truth in healthcare advertising as it was. This bill was particularly situated to protect anesthesiologists from nurses saying that they were nurse anesthesiologists. That's my interpretation of the bill.
Madam Chair, may I continue? Thank you. So I'm trying to read through this to kind of figure out where there's really any substantive change if you take that out. And for me, the truth in advertising, certainly, like I said before, it was part of the badges. Again, that I've had concerns before. And I said this during the public hearing, I believe, and in other meetings, that if someone is not wearing a badge that says what they do or what their specialty is, that is what is actually untruthful and therefore should be unlawful. And one of those things, let's talk about that. What the good Representative Foster had said was regarding autistic children and going to different practitioners like chiropractors who don't hold an MD. And I've said this before, I literally know someone who brings their children not to a pediatric professional, but to a chiropractor, and they also have their dog treated by the same chiropractor. These are the concerns I have about how people understand what someone's role in healthcare is. And the badges would get to that. And so I think that this amendment actually is not a compromise. This amendment just basically kills the entire bill that actually does have to do with truth in advertising to healthcare consumers. And in addition to that, I think that one of our representatives, Representative Cook, had mentioned that the bill that she had passed about 10 years ago about the badges also required, or rather allowed, mental health personnel to take off those badges when out in public with their patients, so that there isn't the possibility of blowback onto the patients. And that is really important too. And that's not part of this amendment, although I think that it should be. So I have to vote no on this amendment because you're taking away the badges. And that is the singular thing that I believe was truly about advertising by healthcare professionals. And I will say, I'm severely disappointed that this amendment takes out the badges. I think it would have been a friendly amendment and we all could have gotten behind it if we just took out the other lines and left the badges. That's all I have to say. Thank you very much, Madam Chair.
Thank you, Representative Linehan. Representative Welander, to be followed by Senator Marks.
Thank you, Madam Chair. I don't really have a question for the proponent of the amendment. I just wanted to make a couple statements on why I would be not supporting this amendment. We don't have the language in front of us. I believe that we should get as much information as possible. The comment that the proponent of the amendment made earlier about protecting professions that don't even exist in perpetuity in the future, I cannot support a statement like that. The acts in the underlying bill, even with the amendment, still are duplicative and are already covered by state statute. And we would be removing a section of the bill that a number of us found to actually be helpful, which is the badges section, or would present any possible contradictions in other statutes regarding badges and identification. So for those reasons, I cannot support this amendment.
Thank you, Representative Welander. Senator Marks.
Thank you, Chair. Through you, I will be voting against the amendments just because I still will be voting against the bill. Everybody is talking about badges. For 2 years, I looked exactly like what Senator Anwar looks right now. I donned and doffed out of the trunk of my car. Nobody ever saw my badge. You can't see Senator Anwar's badge right now. Or maybe you can, but you couldn't see my badge. When I'm doing wound care and it's really not a very nice wound, you certainly don't want my badge draped all in front of the wounds just for infection control. There is so much more to this as a healthcare provider than just wearing a badge, not wearing a badge. And as far as the nursing section go, and I apologize, Chair, I know you said just talk about the amendments, but everybody's
Senator,
been
on the
bringing up.
amendment, if you would, on the amendment only, we will come back to you on the bill itself.
Okay, I've just heard so much badges that I'm just, okay, I will be voting no just because I continue to vote no on the bill. And I guess I could just strike out the whole nursing part, but I won't, as I believe an amendment, especially with our caucus, should be presented before we come here as a friendly amendment. I appreciate it. Thank you.
Thank you, Senator Marks. And
Madam
back to.
Madam Chair, I'd like to withdraw the bill.
Okay, Representative Denning, hang on one second.
Thank you.
I just want to see. So Representative Denning, am I hearing that you are withdrawing your amendment?
I am withdrawing the amendment.
Okay, and the seconder is not here, right? I think it was Senator Summers. No, it was Senator Summers. May I have an opinion from our LCO attorneys on this? Wonderful reminder that we do seconds in our building, but technically do not. So Representative Denning, your amendment is effectively withdrawn. Thank you. Thank you for the conversation among members. I would ask now if there is any further comment or discussion on the bill before us. And that is the substitute language LCO 6190. I believe Senator Marks actually had further comments and Representative Cavros DeGraw.
No, well, I'm just going to go back to the whole nursing part. We do wound care, extensive wound care, and we don't have enough nurses. We don't have enough RNs out there to do it. So now we have hired LPNs, and the RN will go out twice a week and the LPN will go out once a week. I don't expect my patients to truly understand whether we have an LPN, whether we have an RN, or whether we have an RN with a BSN. I've never been called RN BSN. I don't ever care to be called an RN BSN. I am a nurse, and my LPN that I work with is a nurse. And if somebody accidentally calls one of our nurses' aides a nurse, we all, at least I can't say we all, I don't care. All I care is that my patients get the best care possible, no matter what you call us. So I'm not going to, I just want everybody to think about that when you vote on this bill. You all love nurses. You tell us all the time you love nurses. Granted, the CNA proposed this bill, but I don't think any nurses are really out there screaming and yelling about this bill. So I just ask everybody to remember that. I certainly don't want an LPN to get in trouble because she is called, or a nurse's aide, because they are called a nurse and not an LPN, RN, RSN, BSN. Thank you.
Thank you, Senator Marks. Representative Cavros DeGraw to be followed by Representative Berger Gervalo.
I feel like I'm saying this a lot lately. Thank you, Madam Chair. I really was not going to speak on this today. I have really gone back and forth on this. And I would say that I was in firm no coming into this meeting, but now I'm not so sure. I will say I still struggle with what is the actual enforcement mechanism for this bill? How exactly would we actually enforce this?
Representative, if I may, we are having some difficulty hearing you.
Trying to lean in. Does that help at all?
Much
Okay.
better.
Let me just go back. I was a firm no coming into the meeting. I'm freakishly large head now that I'm leaning in, but I will tell you that now I'm not so sure because while I still have concerns about how you would actually enforce this anywhere, are you going to have like some sort, we used to joke about the HEPA police, like, are we going to have somebody just sort of like, looking so egregiously at every little thing? That does worry me. But after the amendment and after some of the conversation, while I still object to the title of this bill, I'm not sure I object to the spirit of this bill. We do need our patients protected. We do also need to have the appropriate number of nurses, doctors, specialists, providers, everything you could think of. We need to have all of those. to save our healthcare system, frankly, because I have real concerns about our healthcare system and whether or not it's going to fail entirely under the weight of so many, obstacles. So I honestly don't know when you call the roll how I'm going to vote at this point, because I don't know that we are doing the critical work that needs to be done with this bill, but I don't know that this bill isn't necessary at this point. So I thank you for letting me speak and for hopefully hearing my frustration on what we're actually doing here and what the right thing ultimately is by the patients of Connecticut, because that's who this bill is supposed to be about. Thank you, Madam Chair.
Thank you, Representative Cavros DeGraw. Representative Berger Javallo.
Thank you, Madam Chair, and my apologies in advance. Now my thanks in advance for you removing the raised hand function, because it really doesn't seem to be working. I apologize. I will keep really brief here. I could just say ditto to many of the things that Rep. Foster shared, many of the things that Rep. Cavros DeGraw shared. I have never felt more on a seesaw in terms of knowing which way to vote, I think, on any bill so far in my history in the legislature. I believe I am probably going to remain a no for today. And again, I'm still working through this, but primarily because of the concerns that have been expressed to me by, that's my kid eating in the background. I guess you probably don't need to see that. By the PAs and APRNs in my district. I've heard from a great number of them, and they have asked for us not to move forward with this. I will most likely be a no, but I will also be very willing to engage them to find out what would be an acceptable an acceptable level of work to do to get it to something that was acceptable. So thank you very much, Madam Chair.
Thank you very much, Representative Amy Berger Javallo. I am not seeing any other comments, Senator Anwar. Before I wrap this up, do you want to make any final comments?
Pardon me?
Senator?
Madam Chair.
Yes, Senator Anwar, please proceed if you're able to or would like to. Make
Yeah, no, I appreciate everybody's indulgence, and I think it's important to know something interesting happened earlier, that it was suggested that it is okay for people to start to call themselves cardiologists. It was okay for people to call themselves as oncologists, and that is, if that does not convince people that we have a problem brewing in our state, then we will have to wait for a few major bad outcomes to come back here around this table and then get a unanimous yes. But I do want you to know that there is a problem brewing. There is a condition, there's a situation that's getting progressively confusing for the people. If we are here representing the consumers, and the consumers are getting mixed messages, and they don't even know, and we are not willing to share with the consumers then as a public health committee, we may have more work to do. I think this is an important issue, and I do want people to consider this based on our responsibility from a consumer protection perspective, but also make sure that the patients are getting the care from the best possible source that they need for the best possible care that they can get. There are specialty issues that are needed. If you have a melanoma, you need a dermatologist to be able to help out in that process. If you have a coronary that's blocked, you need a cardiologist to do that. And maybe I'm ahead of the curve, but I want you to know that this bill is very relevant today, and it's going to be far more relevant tomorrow. Thank you so much, Madam Chair.
Thank you, Senator Anwar. I think I may have heard a little bit differently in terms of the conversation earlier related specifically to nurses. But I think that's part of the struggle with our conversation here. So before we close, I'd like to make a few remarks. To every healthcare provider in the state of Connecticut, Whether you are a nurse, a doctor, an anesthetist, a nurse anesthetist, an anesthesiologist, a chiropractor, an acupuncturist, in any way, for those of you who are serving the people in the way that your scope intends, faithfully, carefully, and so much so through COVID, we thank you. And we're grateful for you. And I know that this conversation has been difficult here today and over the course of the weeks that we've had it. I think every one of us here at this table shares the goal of assuring that our patients, our neighbors, our families, our friends are properly protected, of endeavoring to help us understand who is serving us at that time of service. As healthcare becomes increasingly specialized, it can be confusing for many of us to understand exactly who is providing service and what kinds of qualifications we have. Fortunately, in Connecticut state statute already at this point, we do have, as Senator Summers referenced earlier today, existing law. And existing law, and this is from our OLR report, has a somewhat similar but far less detailed provision than what this bill would provide. And under existing law, I do want to note that it is a Class D felony for someone who is not licensed as a physician to use the terms physician, surgeon, medical doctor, osteopath, or doctor, or the initials MD, DO, or doctor, with the intent to represent or in any way likely to induce the belief that the person practices medicine, is a licensed physician, or may diagnose or treat any injury or disease. This bill seeks to be more specific in some areas and more explicit in what is and is not able to be done. And I certainly respect the intent of that bill. I will, as I have on a number of the bills here before us today, recognizing that we will be continuing conversation on this, I will vote in support of this bill moving forward, but I share some of the concerns that folks have, and Senator Amor has been a wonderful partner in dialogue with me to try and work through some of the concerns we have so that we can get to the underlying intent of what all of us here endeavor to do. And as always, I very much appreciate the respectful conversation among and between members. And again, can't say enough to all those providers out there who are helping us to get through some very difficult times. We thank you. And with that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes no.
Senator Summers, Representative Claritas Detrier,
Representative Claritas Detrier votes no.
Representative Belton,
Representative Belton votes yes.
Representative Berger Givallo,
Berger Givallo votes no.
Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio,
Representative DiCaprio votes no.
Representative D'Amico,
Representative D'Amico votes no.
Representative Denning,
Representative Denning votes no.
Representative Elliott, Representative Foster,
Representative Foster votes no.
Representative Jenga, Representative Gilchrist,
Representative Gilchrist votes yes to get it out of committee and keep working on it.
I guess it's a question of like what,
Representative Calveras DeGraw,
Representative Cabarrus DeGraw also votes yes to get it out of committee with a whole lot more work to do.
Representative Jenga votes yes.
thank you, Representative Django. Representative Kit,
Representative Kit votes yes to get it out of committee, but with the reservation that it needs a lot more work.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes to work on it.
Representative Morrow, Representative McCarthy,
Representative McCarthy.
Representative McCarthy,
Representative McCarty votes no.
Representative Palm,
Palm votes no.
Representative Perello, Representative Rader,
Representative Rader votes yes with the hopes that we absolutely better language and make some great improvements.
Senator Rahman, Senator Rahman, Representative Clinton Hughes, Representative Ryan,
Hughes votes no.
Senator Matthews, Representative Steinberg,
Representative Steinberg votes no.
Representative Welander,
Representative Welander votes no.
Representative Zupkis, Senator Slatt,
Senator Slatt votes yes.
Representative Ryan,
Representative Ryan votes no.
Representative Reddington Hughes,
Reddington Hughes votes no.
Senator Rahman, Representative Morrow, Representative Perello, Representative Elliott, Representative Cook, Representative Carpino, Senator Cabrera, Senator Representative Parker, Senator Summers. Thank you, Madam Chair.
Thank you, Madam Administrator. Again, the reminder that votes will be held open today until 5 p.m. We do have one more item before you all go. We have our consent calendar. So I will read those items to remind us what is on the consent calendar before we vote. That's item number 4, Senate Bill 1065, an act concerning the Department of Developmental Services recommendations regarding various technical revisions to developmental services statutes, JF to the floor. Also on consent is item number 5, Senate Bill number 1066, an act concerning the Department of Public Health recommendations regarding food inspectors. This is a JF to the floor. Item number 12, House Bill number 6727, an act concerning the Department of Public Health recommendations for implementing the recommendations of the Lead Poisoning Prevention Working Group. This is a JF to the floor. Item number 13, House Bill 6728, an act concerning the Department of Public Health recommendations regarding local health departments' food protection program audits. This is a JF to the floor. Also on consent, item number 14, House Bill number 6729, an act concerning the Department of Mental Health and Addiction Services recommendations regarding the membership of various advisory boards and councils. Also item number 15, House Bill number 6730, an act concerning the Department of Public Health's recommendations regarding the Tobacco and Health Trust Fund and the requirement to check identification prior to selling cigarettes or tobacco products, JFS to the floor, LCO 6181. Also on consent, item number 17, House Bill number 6741, An act improving the safety of healthcare providers and patients. This is a JFS to the floor, LCO 6164. And finally, item number 18, House Bill number 6819, an act concerning lactation consultants, a JFS to the floor, LCO 6167. I will amend my statement. Item 14 is LCO number 6183 for clarifications. The consent calendar has already been moved and seconded. So with that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Senator Summers, Representative Clara Desdichia,
Representative Claire Destetria votes yes.
Representative Belton,
Representative Benton votes yes.
Representative Berger Givallo,
Rep. Berger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné,
Representative Dauphiné votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kidd,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Linehan votes yes.
Representative Morrow, Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slack votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis, Senator Rahman, Representative Perello, Representative Morrow, Representative Elliott, Representative Cook, Representative Carpino, Senator Cabrera, Senator Summers. Thank you, Madam Chair.
Thank you, Madam Administrator. Votes will be held open until 5 p.m. I don't think I've said that yet today, have I? Just a couple of items before we recess. Just announcements. We will have a hearing, a public hearing on the 22nd at 11. We have a number of pretty weighty bills, and I expect that we will be hearing from a lot of people on the 22nd. Our next committee meeting will be held Monday, the 27th at 11:30. Again, I anticipate that we will be having robust discussion on the bills before us on the 27th. Our JF deadline is the 29th, and I would suggest that people just hold the 29th in the morning so that you have that available for us in the event that we need it. As I mentioned during the committee meeting, we are always so incredibly grateful for our OLR and LCO attorneys, James and Nicole and Nick and Eileen. We're very thankful to you, and we wouldn't be here without you. Often legislators say that we write the bills, but we know that you write the bills, and we are so thankful for that. To our administrator, Beverly Henry, and the team that is behind the scenes, and so much goes on behind the scenes. Kathleen and Kate and Dave and Peter, we're grateful for all of you. And as Senator Anwar said the last time we gathered, we're also grateful to CTN because they allow the conversations to be transparent to the people of our state. So I know that there are folks who are going to be waiting to vote, which you can do until 5 p.m. And with that, we are in recess. Thank you, everyone.
Thank you.
Representative Django?
I would just like to check, Madam Administrator. Did I vote on item number 1 and item number 7? Item number,
Just a moment, sir. Yes, you did on item 1. And what's the other one?
number 7, which was the Senate Bill 5197.
Yes, you did. You're all set.
Thank you, Madam Administrator. Sorry for the inconvenience.
You're welcome.
Take care, Beverly.
Senator Slapp, you voted on consent, so let me check the other bills for you, please.
Thank you.
You need to go away. Sorry. You said that's a Derek Slapp. Wait, what a neat person. I said that's you. Can you wait a minute, please? Sorry. I'm talking to you, Kevin Ryan.
So the summons is also ready. The line form. Copy of that? Wait, that's a mess.
Senator Slot, you have quite a few. Item number 1, Senate Bill 171.
Senator Slot votes yes.
Thank you. Item number 2, Senate Bill 986.
Senator Slot votes yes.
Item number 7, House Bill 5197.
Senator Slot votes yes.
Item number 8, House Bill 5902.
Senator Slot votes yes.
Item number 9, House Bill 6298.
Senator Slot votes yes.
Item number 10, House Bill 6488.
Senator Slot votes yes.
Item number 16, House Bill 6731.
Senator Slot votes yes.
Item number 19, House Bill 6837.
Senator Slot votes yes.
And you voted on consent, so you're all set.
Thanks so much. Have a good rest of your day.
Just a moment before you go. Make sure. You're all set. Thank you.
Okay, thanks. See you, Lenny.
There you go. I think I have 8, 9, and 10.
Good. Okay. Representative Ryan, House Bill 5902. How would you like to vote? House Bill 6298. House Bill 6488. Thank you, sir. And if you're missing any, I'll give you a call.
All right.
Okay.
Hi, it's me. I have the very last one because I
That's
have
okay.
10:16.
Oh, boy.
I have no.
Would you like to vote on that? Senate Bill 1016?
No. No.
Thank you.
I think I'm still on that.
Yes, you have.
Yes.
Okay, here.
OMG with the OR stuff.
So Senator Summers, how would you like to vote on
I would like
consent?
to vote yes.
Thank you.
What is there a patient in there?
Good. Yeah, he's doing it. No, he's not in the room with the patient. He's out in that room. Please, shut up. You're becoming much worse than I am.
Can I pick up what's on the table in there?
Hello. I'm checking for your missing votes.
Thank you. I could tell you, but I may be wrong.
Yeah, last time I messed up, so.
We all mess up sometime.
On that one. Item number 7, House Bill 5197.
Yes.
Item number 16, House Bill 6731.
Yes.
Item number 10, House Bill 6488.
Yes.
Item number 9, House Bill 6298.
Yes.
Item number 8, House Bill 5902.
Enthusiastic, yes.
Let me just make sure I'm not missing anything with you.
Okay. Yeah, I had 7, 8, 9, 10, and 16.
Nope. You can stand behind me. You're all set.
Thank you so much. Have a great afternoon and thanks for all you're doing.
Thank you.
It was messy. Obvious.
Oh, boy.
People's mics off.
Okay, let's see. You're missing that one. Okay. You are missing item number 6 on the agenda, Senate Bill 1068. How would you like to vote?
Representative Oscar votes yes.
Item number 7, House Bill 5197.
Representative Foster votes yes.
Item number 8 on the agenda, House Bill 5902.
Representative Foster votes yes.
Item number 16, House Bill 6731.
Representative Foster votes yes.
And then you did vote on consent, and just double check and make sure, so I don't have to check you then. Yes, you're all set.
Thank you so much. That's what we did.
Are you for Christian? You were like a cop from the arrest. Oh, how are you doing? I am here and I'm surviving and I'm well. I'm pretty good. Yes. Oh, that's not good.
I'm gonna have to go to school when I came down. Back, I felt like I had to run back in. And then I had to lunch.
6, 7, 8. 17. Which one do you miss? Yes. You did. Commissioner, you missed House Bill 5197.
Oh, yeah.
You missed House Bill 5902.
Yeah.
Senate Bill 171, you got that one. Senate Bill, yeah, you got that one. You got that one. Item number 9. We had to cancel your funeral meeting today because you guys were still downstairs. So I'm going to try to reschedule. Item number 10, 6488. Item number 11, the Governor's Bill 6669. You get it? Yeah, we started it out. So item number 16, House Bill 731.
Yeah.
And item number 19, 6837.
Yeah.
Let me make sure you did consent. Thank you.
Beverly, are you there?
Hey, Jillian, Representative Gilchrist, one moment, please.
Okay, thanks. You can call me Jillian.
I'll call you. Okay. Can you hear me, Representative Gilchrist?
Yes.
Okay. So let me see what I have here for you.
Let me think, is that-
Okay. Matt Barrett. And what's her name?
I had stepped out for a moment for item number 10, House Bill 6488, and I haven't been able to confer with the administrator yet. Did you vote on that one?
I'm unsure. I
Okay.
stepped, yeah, that my issue is I stepped out for like, I don't even know how long and I missed, I think I missed. I don't even know if I missed.
Okay, let me.
We're urging the committee to carefully evaluate the Biden administration disclosure of ownership and additional disclosure of parties information for skilled nursing facilities. Proposed federal rules and
Oh, is that on your end?
Yeah, sorry, I'm on another meeting, but I'll mute it.
Okay, so on item number 16, House Bill 6731. How do you vote?
Representative Gilchrist votes yes.
And then item number 19, House Bill 6837. How do you vote?
Representative Gilchrist votes yes.
All right, and if you hold on one moment, I'll be right back to find out if you voted on House Bill 6488. One moment, please. Okay, so Representative Gilchrist, how do you vote on item number 10, House Bill 6488?
Representative Gilchrist votes yes.
Thank you very much.
Thank you
And
so much.
be
Have a
all
great
set.
afternoon. Okay,
Thanks, you too.
bye.
Bye. And Rep Zup.
Hi.
Hi, let me rename you so that we're legal here.
Oh, there we go.
Okay, there you are. Okay, so let me close the door. Just got back upstairs. Okay, so I'll start with the consent calendar.
Yes.
And those were items 4, 5, 12, 15, 17, and 18.
Hold on. 12, 15, and 18.
12 through 15.
12,
12,
13, 14, 15. Okay.
And then 17, 18.
Okay. Yes.
And you got 4 and 5 as well?
4 and 5. Yep.
So,
yep.
Okay, awesome. How do you vote on the consent calendar?
Rep Septis, yes.
Okay, and I know there were a couple more. Okay, on item number 3, Senate Bill 1016.
Rep Septis, no.
Okay. Item number 6, Senate Bill 1068.
Rep Septis, yes.
Yes. Okay. And then I had stepped out for item number 10, House Bill 6488, and I haven't been able to confer with the administrator yet. Do you remember how you don't?
Rep
Is
Septis,
it a
yes.
Okay. Just in case.
Yeah.
And so, yeah, that's all. You're all
That's
set.
it. Thank you.
Thank
Bye.
you so much. Good evening. Hello, Representative Carpino. How are you?
I'm good. It's nice to see you.
Nice to see you too. Okay, so I'm going to start with our consent calendar.
I would like to vote yes.
Do you want the item numbers or just?
No, I just left at the end, so I was taking notes.
Okay, so, and then I believe. And then on item number 3, Senate Bill 1016, how do you vote?
No. I think that's all I missed.
And then I had stepped out for number 10. Did you vote on item number 10, House Bill 6488?
Voted yes.
Okay.
We're,
Perfect. I just needed to check with the, I just haven't, we haven't been able to do that yet. Okay, and then yeah, you're all set, Dr. Carpino.
thank you. I'll see you later in the week.
Thanks, you too. Bye-bye.
Bye.
Hello, Representative Perillo.
Kate, how are you?
I'm great, thank you. How are you doing?
Fantastic. Sorry I had to hop off.
No worries, no problem. So the first one I have is our consent calendar.
Yes.
Which has, okay, Rep Perillo votes
That's
yes.
easy.
All right. And let me double check. See. Item number 3, Senate Bill 1016. How do you vote?
I'm a no on 1016.
Okay. Double check the rest of them. I stepped out at number 10. Did you vote on number 10, House Bill 6488?
Jeez.
It's okay, but Bev probably has it. I just haven't been able to confer with her yet.
Yeah, hold on one second. Let me
Nicotine.
go back and check my notes. You know what, Kate, I don't want to hold you up. If you
Let
don't
me double
mind,
check with Bev, and I'll text you.
that's perfect.
Okay, which is probably fine, but I just haven't been able to. But
Oh,
I'll
no
text.
worries. I get it. I get it.
Thank you so much.
Thank you. I appreciate it.
Have a good evening. Bye-bye.
You too.
Hi, Mara. How are you?
Good. How are you?
I'm wonderful. Thank you. Thank you. So, well, I'll start with our consent calendar.
Okay.
That's items 4, 5, 4 and 5, 12 through 15, 17 and 18.
Okay.
And how do you vote on that?
Yes.
Okay. And then item number 3, Senate Bill 1016. How do you vote on that?
No.
And then on item 6, Senate Bill 1068. How do you vote on that?
Yes.
And then item number 8, House Bill 5902.
No. Excuse me, 85902, is that correct?
Correct. I'm losing you. Okay, I'm sorry. Yeah, number
Sorry?
8 is, yes, number 8 is House Bill 5902.
Rep Mara votes no on that.
Number 8, okay. And number 9, House Bill 6298.
No.
No. Okay. And then item number 16, House Bill 6731. How do you vote on that?
Wait a second, I am missing one. Looks like, what
Missing that
about,
number 10?
correct.
Okay, yeah, I stepped out for that and I was gonna check to see what Bev have, and I haven't been able to do that yet. How do you vote on item number 10, House Bill 6488?
I vote yes on that.
Yes, okay. And then on item number 16, House Bill 6731.
I'm sorry, did we miss item number 11?
I have you with a no for 11 on House Bill 6669.
Oh, okay, right, because we did that one first. Okay, I'm so sorry. Okay, so you're on item number 16.
16.
6, 7. Okay, I vote no on that one.
On that one, okay. And then item 19, House Bill 6837.
I vote no on that one.
Okay, and you're all set.
Great, thank you so much. Appreciate it.
Bye-bye.
Okay, bye-bye.
Okay, Representative Cook, how do you vote on our consent calendar?
Cook votes yes.
And then on item number 3 of the agenda, Senate Bill 1016.
Cook votes no.
And item number 6 of the agenda, Senate Bill 1068.
Cook votes yes.
And item 19, House Bill 6837.
Cook votes yes.
Great, thank you very much, Representative Cook.
Thank
You're
you
all
very
set. And me. That was I didn't capture my audio. So just to recap, Rep. McCarty, how do you vote on Senate Bill 171?
I vote yes.
Thank you. And then on item number 2, Senate Bill 986.
I vote yes.
And then on item number 7, House Bill 5197, how do you vote?
And let me just read the title again. Sorry. Number 7, did you say?
Yes.
And what is that title?
Defending machines with the emergency contraception on
Yeah.
higher ed
And the
campuses.
higher ed
Mhm.
campus. Yeah, okay, I vote yes.
And on item number 8, House Bill 5902, the food allergy.
Yeah, I
waivers.
vote no on that.
No. Okay. And on item number 9, House Bill 6298. Civil, no, okay. And on House Bill 11, 6669. Did I miss? I think I missed 10. Did you miss? Oh, you missed. Okay, you missed 10.
Yeah.
Okay, and thank you for that.
Yeah,
How do you vote?
and I vote yes.
Yes. Thank you. And then 11.
I vote no.
And that's it. You're all set.
Oh, wonderful.
Thank you. Thank you so much. I appreciate that. I appreciate that.
I appreciate you
Anytime.
saying-
Oh my gosh, yeah, of
I
course.
just think
Hey, Rep Elliott, how you doing?
There we go. Can you hear me?
Yes, how are you?
Hey, how's it going?
Good, good. So I'll start with the consent calendar.
Great.
It's items 4, 5, 12 through 15, 17, and 18. How do you vote?
Yes.
And item number 1, Senate Bill 171. How do you vote?
Yes.
And item number 3, Senate Bill 1016, how do you vote?
Yes.
Item number 6, Senate Bill 1068, how do you vote?
Yes.
Item number 7, House Bill 5197, how do you vote?
Yes.
Item number 8, House Bill 5902, how do you vote?
Yes.
House, item number 9, House Bill 6298, how do you vote?
Yes.
And item number 10, House Bill 6488, how do you vote?
Yes.
Item number 16, House Bill 6731, how do you vote?
Yes.
And Rep. Elliott, you are all set. Thank you so
Thank you
much.
so much.
Have a good afternoon. Bye-bye.
You
Okay. Okay, so I'll need you to stand behind me so that you're, do this.
So the one coming.
Hold on.
behind me.
Okay, so, let me see something here.
All of the bill is here. Yeah.
Okay, so on our consent calendar, we had items 4 and 5, 12 through 15, and items 17 and 18. And how do you vote, Senator Roman?
Yes,
Yes. Okay. And then on item number 1, Senate Bill 171, how do you vote?
171.
Mhm.
171.
Yes. How do you vote?
171. All right.
Yes. It's allowing pharmacists to prescribe medication.
Yeah, I think the majority Democrat vote yes. am I right?
Yes, okay.
I agree with them.
That's all right. And then item number 2, Senate Bill 986, how do you vote?
I think the majority Democrat yes.
Uh, Okay, so item number 2, Senate Bill 986, Senator Roman, how do you vote?
Oh, yes.
And item number 3, Senate Bill 1016. How do you vote on this?
1016. No.
Okay. Yeah. And on Senate Bill 1068, item number 6, how do you vote?
1066. The bill yes.
And on item number 7, I need to get his, I don't know how he voted yet on that. But item number 7, how do you vote?
Yes.
Okay. And on item number 8, House Bill 5902, how do you vote?
Yes.
Okay. And on item number 9, House Bill 6298, how do you vote?
Yes.
And item number 10, House Bill 6488, how do you vote?
Yes.
Okay. That's the one on about cigarettes, tobacco products, and nicotine delivery.
Hold on.
Okay,
What is that?
sure. 1 second. Hello, Senator Gordon.
Hello, how are you?
I'm great, thank you. How are you doing?
I'm good. I finally was able to get to a Zoom access, so
Excellent, excellent. So I'll go fast. So the first item we have a consent calendar
yes.
for items 4 and 5, 12 through 15, 17 and 18.
Okay.
Okay. And Senator Gordon, how do you vote on the
I
consent?
vote yes.
Okay. Okay. Then item number 1, Senate Bill 171. How do you vote?
I vote yes.
Okay. And item number 2, Senate Bill 986.
I vote no.
Item number 3, Senate Bill 1016.
I vote no.
Okay. Item number 6, Senate Bill 1068.
Let's see, 1-0. I'm just pulling up my agenda so I can just see the title here. I vote yes.
And agenda item number 7, House Bill 5197. How do you vote?
I vote yes.
Okay. And item number 8, House Bill 5902.
I vote no.
And item number 9, House Bill 6298.
I vote no.
And item number 10, House Bill 6488. How do you vote?
I vote yes.
And item number 11, House Bill 6669.
I vote no.
And item number 16, House Bill 6731.
Let me just pull that up here. 6731. I vote no.
Right. And item 19, House Bill 6837.
I vote no.
All right. You're all, thank you so much, Senator Gordon. Hope you have a
Thank
good,
you.
good trip.
Yes, thank you very much. Have a good
Thank-
rest of the day.
You too. Bye-bye. Okay, Senator Rumman, item number 10, House Bill 6488. How do you vote?
Yes.
Yes, okay. And on item number 16, House Bill 6731. How do you vote?
6731?
Yes.
Yeah.
And on item number 19, House Bill 6837. How do you vote?
Yes.
Okay. And you, to be sure, because we stop in the middle. You're also?
Awesome.
Okay, thank you so much. Hope you have a good day. Okay, so keep that. And then on my favorite. Awesome.
Hey, Kate.
Hi. Hey, so I have Senator Cabrera and Representative Parker. So I'm going to go alphabetical. Let's start with Senator. Let me just close the door.
Okay.
Okay, Senator Cabrera.
Aye.
Hi. So our first item, we have a consent calendar with items 4 and 5, 12 through 15, 17, and 18.
Senator Cabrera votes yes.
Okay. And then item number 1, Senate Bill 171.
Senator Cabrera votes yes.
And item number 2, Senate Bill 986.
Senator Cabrera votes yes.
And item number 3, Senate Bill 1016.
Senator Cabrera votes no.
And item number 6, Senate Bill 1068. How do you vote?
Senator Cabrera votes yes.
Item number 7, House Bill 5197.
Senator Cabrera votes yes.
And item number 8, House Bill 5902.
Senator Cabrera votes yes.
And item number 9, House Bill 6298.
Senator Cabrera votes yes.
Okay. And let's see, item number 10, House Bill 6488.
Senator Cabrera votes yes.
Okay. And item number 11, House Bill 6669.
Senator Cabrera votes yes.
And item number 16, House Bill 6731.
Senator Cabrera votes yes.
And item 19, House Bill 6837.
Senator Cabrera votes yes.
Okay, excellent. You're all set. Thank you so much. Hope you have a good evening.
Thank you. Have a great evening.
Hi.
Hi.
Representative Parker, do you mind if I let Senator Anwar go?
Yes, please.
He has just a couple votes.
Go for it.
Okay.
Hey, Doc. Hey, Kristen.
How are you?
We're good.
So happy.
Congratulations.
Thank you.
Okay.
Go ahead. Thank
Okay.
you.
Senator Anwar, item number 7, House Bill 5197. How do you vote?
Senator Anwar votes yes.
And item number 8, House Bill 5902.
Senator Anwar votes yes.
Okay, I'm just gonna go ahead and vote the,
And item number 9, House Bill 6298, how do you vote?
Senator Anwar votes yes.
Okay, and item number 10, House Bill 6488, how do you vote?
Senator Anwar votes yes.
Okay, and item number 16, House Bill 6731.
We did take a vote on it. I'm going to vote. Can you read me the title if you don't mind?
Sure. An act concerning the Department of Public Health recommendations regarding change in ownership of healthcare facilities.
Yeah. Was there people? There's need to be more conversation on this, and I'm just trying to see. I don't want to vote no on the title, but I do need to have more conversations. I'm just going to vote yes on it.
Okay.
Thank you. Sorry.
No, it's great, and you're all set. Thank you very
Okay.
much.
Thank you. Thank you
very
so much. Take
Okay.
care.
Thanks.
Bye-bye.
Okay, Representative Parker,
Hey,
how you doing?
Doing well.
Congratulations again. This
Thank
is very exciting.
thank you.
And when they announced the baby's name, they said Charlie something Parker. I was like, I know what you did there. I hear you. That's what happens. You become a mom, but you start telling dad jokes, you know? Okay, so we have a consent calendar. We have items 4 and 5, items 12 through 15, and items 17 and 18. And how do you vote, Rep. Parker?
Yes.
And then on item number 1, Senate Bill 171, how do you vote?
Yes.
And on item number 2, Senate Bill 986, how do you vote?
Yes.
And on item number 3, Senate Bill 1016,
Yes.
and item number 6, Senate Bill 1068,
Yes.
and item number 7, House Bill 5197,
Yes.
and item number 8, House Bill 5902,
Yes.
and item number 9, House Bill 6298,
Yes.
and item number 10, House Bill 6488,
Yes.
and item number 11, House Bill 6669,
Yes.
and item number 16, House Bill 6731,
Yes.
and item number 19, House Bill 6837.
Yes.
Okay, you're all set. Thank you
Thanks
so
so
much.
much, Kate. Thanks,
Anytime.
Bev.
Bye.
Bye. Al.
Hi, Rep Elliott. How are you?
Okay,
Okay,
Here we go.
thank you. Hi, Rep Elliott. How are you doing?
good.
Thank you for calling me back. As item number 19, House Bill 6837, how do you vote?
Yes.
Yes, all right. Thank you. You're all set. Happy
All
to
right.
get everything.
Thank you.
Bye-bye.
Bye.